Basically, we're going to kick off now. We're going to be talking about what I really wanted to speak to you guys about and have David Giwerc, founder of ADCAR. He's currently, I can't see him here at the moment, but what I'm going to do, what was really good last year is that we kind of got in front of the issue of certified ADHD. Oh, here he is. Here's David. Hello.
Hello, Stephanie. How are you?
I'm good. How are you?
Good. I'm sorry I'm a little late. I couldn't get on, but I'm on now.
Fantastic. Like, I'm just always delighted and honored that you would make space for us here in the UK and for me to do the ADHD Coaching Summit. It's fantastic to see you.
Are you kidding? You people in the UK, you're my family. All of you people out there, you're my family. UK and US and all of us are tied in so close that I'm always energized just thinking about working with you.
Yeah, well, we really need you at the moment, actually. You've probably seen, I'm sure it's not just a UK
No,
problem in terms
no.
of, yeah.
It's global. It's global. It's um, the UK is just one example. It's a very powerful and strong one of what's going on in our profession, in the coaching profession. But in general, with ADHD, there's not enough physicians to diagnose. The waiting lines to get in are impossible. There's not enough people to. It's an epidemic. That's the only way I can. It's an epidemic, and we have to help manage that epidemic and help people with ADHD, even when they're diagnosed, to navigate through the turbulence of it, because there's a lot of education that has to be found and people all over the world that where do I begin? And so as coaches, we're great at helping them navigate. And you need somebody to be able to process all your different. There's so much I could talk years about this.
I
I
know.
I got to catch myself.
That's that's why I thought it might be. I kind of have a few questions to
Yeah.
because you are the expert. For anyone that's just joined and doesn't know who David Gewerk is, he's the founder of ADCAR, one of obviously the world's first accredited ADHD coaching training provider by the International Coaching Federation, right in the world,
And pack.
and PAC. And you've been,
Yeah.
and how long ago was that, David, that you created?
Well, this will be our 25th year. We're celebrating this year at the International ADHD Conference. We're going to be celebrating our 25th year. The 25th year as an organization training ADHD coaches, but it's been over 30 years for me as a coach.
Wow,
Yeah.
wow.
So I've seen a lot of change, good change, but we have a long way to go still.
Yeah, and so like you said, there's the diagnosis issue, obviously the wait list here too, sometimes up to 8 years.
Oh
It's,
my goodness.
yeah, I know, it's crazy. It's really bad. Yeah. Have you seen what's happening in Australia though, in terms of they're going to be getting the GPs to be able to diagnose? I mean, what do you think of that, by the way?
Well, I don't know enough about it, but I've heard
Mm.
about it. So here's the thing. In most medical schools across the world, ADHD is not taught in medical school. Especially in the United States, they may have an elective on it, not a lot. Tom Brown, who just recently passed away, unfortunately, used to tell me when he was at Yale, uh, he would get, a couple of hours with the residents, the doctors. That was it. And you can't learn about ADHD in 2 hours. And my physician who diagnosed me told me that the way he learned best about ADHD was through me and his patients. And I was one of the first people in the area that I live in, which is about 750,000, Albany, New York, the capital. I know I was the first person that probably was diagnosed and given a stimulant, because back then the doctor wouldn't give you a stimulant. I'm not going to give you a stimulant. Some of them still struggle to give it. Now, if you've got a heart condition and things like that, yes, you have to be careful. But to bring people up to diagnose something quickly, if they have a good process and they have good webinars and things like that, yes. But I think they should still consult with a psychiatrist that's trained in it. My feeling is there should be somebody to monitor it, because you're talking about people's lives. It's not just the label you're giving them. You're giving them medication, you're giving them therapy if they need it, and coaching to navigate. And the greatest success with people with ADHD have been when they are somebody, it's bioneurological. So in 80% of the cases, you need medication. The medication gives you the ability to stimulate the dopamine neurotransmitters that are stagnant, that don't work. But here's the other thing, why I'm hesitant. Some statistics say up to 80% of people with ADHD also have a co-occurring condition. And so sometimes, you can be given a psychostimulant and not know about the secondary condition, and it can exacerbate even, creating suicidal tendencies. You know, you,
Good
it's
point.
the stimulant is works really well for most issues with ADHD, but when there's something else going on underneath, you have to know somebody that can, if they know something else like depression, anxiety, bipolar, now autism, auto ADHD is becoming big. So really what we're finding out is when those secondary conditions don't work with medications, it's probably because you haven't been diagnosed with ADHD. We're finding that it is the foundation for all these other things. And so think about it. You've got depression, you've got anxiety disorder, and you don't have enough people to sit back and say, well, let's do an assessment here and find out if you have ADHD. And what makes ADHD, it's not that you just can pay attention or can't pay attention. It's not that you're impulsive. Sometimes it's the intensity and duration and the frequency of it impairs quality of life. If I can't pay attention to my boss and I'm late all the time and I lose my temper, I'm not going to be working there too long. Okay. So these are all things that I don't know enough about Australia, but Michelle Toner's out there. I'm sure she'll tell me. I know in the US there's an organization called APSARD, which I used to be on the board, which is creating webinars to train primary care physicians, to treat ADHD. My understanding, they've reached about 2,500 people, which is
Wow.
peanuts. It's hundreds of thousands of primary care physicians.
Point there. Yeah.
Yeah. So, but anything is good. We have the same problem with coaching.
Yeah, I
Listen,
was gonna say this perfectly leads into the issue with the coaching industry.
yeah. So before I move on, one thing I need to say, there's been research globally about most physicians, very small percentage of physicians feel comfortable diagnosing ADHD at all.
Mm.
Okay. Now add that to psychiatric practitioner clinics that are completely full and they're not taking new patients. So in the US, what's happening, this is a new trend. We have what's called nurse practitioners and physician's assistants. And they're not doctors, but they go to special training and they're well trained to be able to give these medications. Okay. And they're like a PA or nurse practitioners, many of them are supervised by a psychiatrist. One of them is allowed to go independent. I think it's nurse practitioners and the PA has to go under the supervision of a doctor. But it's helped. It's helped because when you can't find a doctor, somebody who understands the mechanisms of the brain and which medications work well. But the pill doesn't give you the skill. That's the first thing I'm going to say. The pill just puts you on a level playing field so you can pause, you can pay attention, you can control your impulses and self-regulation a little bit better. But you have to do the cognitive stuff. You have to find out where your intrinsic motivation is, what activates your brain. But it's not just about doing that, it's about sustaining it. So this takes special training. And what we've got is the ADHD coaching profession has skyrocketed. It's expanded. At ADCA, we have a waiting list in the last 3 years for people to get into the training, sometimes as long as 6 to 9 months to get in. And listen, it sounds great, but it makes me miserable and makes me unhappy because there's all these people that can't get in. And we're limited at the number of classes the size of the classes. And we're doing the best we can. We're doing well. But the problem is these other coach training organizations are proliferating in the UK. Some of them, I know there was one big one that just went bankrupt in the UK,
Yeah.
very big one. We knew about that. You and I knew about that, Stephanie. It was going on. And
Yeah.
you can't go around telling everybody they're terrible. But what you can do is teach people what to ask for. And the first thing that they have to ask for, without saying, tell me what your specialized training is, a certified school has to be part of an accredited program. And let me explain the difference. Universities around the world are accredited. You would not go to a university that wasn't accredited. Those universities have to show their curriculum, their structure, how they work to a governing board that vets it out and says, your school is good enough to be accredited by our standards. And so there are only two accredited training programs in the world for both life and ADHD coaching. It's ADCA, the ADHD Coach Academy, and mentor coaching. Those are the only two. And mentor coaching is very good. They're a lot smaller, maybe not as comprehensive as us, but a very good program. And Alan Graham, who's over there, I highly respect. So there are only two of those. And so we can only take so many, but we're taking on as many as we can. And but it's not only accredited in life coaching with the ICF, we now have a governing body in ADHD coaching, which has a set of standards that says this is what an ADHD coach has to demonstrate to effectively coach a person with ADHD. And that's the key. You can have the knowledge and you can have from the book, but you have to have the practical understanding of the skills and be tested on specific, what they call PAC essentials or competencies with specific markers that demonstrate the coaching behavior. So when anybody gets their certificate, they've gone through, at the basic level, 125, 150 hours, at the advanced level, 250 to 300 hours, plus they're mentored. They have to have so many coaching hours with clients. There's a whole process. And I can assure you that the process that an accredited coach goes through is much deeper, much more expansive than they would another training program, because I see some of these programs get a certificate in 3 months. Well, a basic coach takes a year and a half. You know, Stephanie, you know what it takes. And an
Yeah.
advanced takes 3 years. And all of our trainers have a minimum of 5 to 7 years experience, and they have three credentials. They have our certification from accredited school. They have ICFs, the International Coach Federation, which is the world's largest, which is life coaching, and the Professional Association of ADHD Coaches. And not just at a basic level, at an advanced level. So we're saying we're going to give anyone who comes into our program the best of the best. And what that means is if somebody's going to go looking for coach training, if there's people on here that want to go for coach training, first things to ask, are you an accredited organization? Okay, by the ICF or PAC. That's it. If they're not, it's your decision. You can go out there and try it, and there are a few programs that are occurring in the UK that concern me a little bit because some of them are hybrid programs where they're integrating therapy into coaching. Yes, and we have to distinguish the lines between coaching and therapy because it confuses the patient. And, we have to watch the language that we use. In therapy, they use words like intervention. We don't use those words. We talk about strategies and programs and tactics. The language is very specific to coaching. And the language that we use in ADHD coaching is very client friendly. It's language when you read the skills that we have. For example, one of the skills that we have that ICF doesn't have is wonder. Wonder. What would happen? What's possible with you if you could put your anxiety to the side for 15 minutes? If you can't put your anxiety to the side for 15 minutes, there's probably something else going on that coaching won't relate to, that would be therapy or things like that. But the most important thing that we do better than anybody in the world, is when a client comes to us and we hear the challenges of their ADHD and we hear this huge gap and void, because very small percentage of people understand their ADHD. It's in the 90 something percentile. It's very small. And we ask them, well, it sounds like you really don't know what situations where your ADHD shows up and where it doesn't. Would it help if I was able to help you with this specific aspect of ADHD? In other words, we don't inundate them with everything about ADHD. We customize the education based on where they are with their ADHD. And that's huge because people say, go read this book. So if I have a client who can't pay attention in school, or I have a client that can't pay attention to work. The first thing I ask them, I said, do you know what interest has to do with attention? What does it have to do with your ability to focus, your ability for your brain to get activated? And they say, I think I know, but I'd really like to know. And I tell them about a 9-year research study done by Nora Valkow, where she found people with ADHD have certain mechanisms in the brain that need to be activated with dopamine. And one of them is they have to be engaged in the brain. Okay. And that starts with interest. But you see, somebody that's not an ADHD coach would take that little piece of interest and make it like the Bible. And it's not. Interest only opens up the door. I can be interested in something, but if it doesn't have an intention or a purpose, might as well, might as well not. I mean, people are interested in going navigating on the internet all day long. Okay, there's no intention. But if there's a purpose with it, there's going to be some positive emotion. So I'm giving you the mindset here of an ADHD coach so everybody can begin to understand how we do it differently. The mindset of an ADHD coach and what makes us different from every other profession in the world is we are focused on what activates and ignites our client's brain and heart. We are about putting emotion with cognition together. And the reason for that is people with ADHD are already in their heads enough and they don't know how to activate their brains. They don't know where to begin. And so the first thing we do is we give them a great understanding of how ADHD shows up in strengths and weaknesses. Okay? What happens when you're not interested in something? Tell me what happens. I can't get going. My brain shuts down. The harder I try to pay attention to it, the worse it gets. And when I share with them, see, if I share with them, well, that's been my experience, it's just one-on-one. We need neuroscience too to help us with this. So I say, well, this 9-year study by Nora Valkow found, and it was 9 years because they were looking for people that had never taken medications before. They wanted to see a raw ADHD brain, and they saw it. And what they found is people that were engaged, children, adults, every age group, the moment they were engaged in something, their ability to activate their brain was significantly increased. Okay. But what the research doesn't show you, and only an ADHD coach would know, it's great to get the brain activated for a period of time, but how are you going to sustain that focus for a longer period? How are you going to sustain it? Because lots of people get interested in things with ADHD and then they don't complete it because it doesn't have the intrinsic motivation. So here's what we're about. For all the people listening, interest is great. It's a starting point. We have what's called a hierarchy of engagement, a hierarchy of activation. It starts with interest. Interest is the first thing. The second one is important. If it's important, it will sustain a little bit longer. But as soon as it stops being important, like I need to get my taxes done, but once my taxes are done, goodbye, Charlie. I'm out of there. The two that we're looking for in ADHD coaching, whether it's a child, an adult, or family, is, and you notice I'm using alliteration here, interest and importance with an I. This comes out of a model called the I model. Okay, I won't go into that because I don't want to, you know, overstimulate you with too much information, but I'm giving you an indication of what we go through. What we are listening for with our clients that very few coaches do is we're listening for what's inspiring to them. What's inspiring? Why? Because when you're inspired, it hits positive emotion in the brain. It hits specific parts of the brain, one called the ventral striatum, which is a part that is also activated with memory. And why do I bring this up? Because most coaches don't realize that people with ADHD make all their decisions based on memory. And interest, what other people don't understand, interest can also be negative interest because anything that activates the brain engages the brain. And so where do people with ADHD initially go? They go to negative interest and negative memory. And why is memory so important? Because if most of the memory you have in your brain that you access and most of the memory that we activate is emotional memory, and negative emotional memory is stronger than positive emotional memory. So people with ADHD have tons of pervasive negative memory, and that's the context that they use to make decisions. So think about that. If you're always paying attention to negative thoughts and you ruminate, how are you going to make a decision? It's not going to create, you need a context. You're looking at failure. You're looking at, I don't do it good enough. So what we do is we begin to teach our clients the importance of positive emotion and being inspired. Because when that part of the brain opens up, inspiration, and I'm going to tell you exactly how we do that, and then we'll talk about accreditation and why they're different. When we do that, when we open up the brain to inspiration and passion, it opens up a part of the brain that we can go to wonder. It opens up a part of the brain where we're putting the anxiety to the side. And I always ask my clients, can we put that to the side temporarily? And we begin to find memory, what we call our magnificent me moments. You're familiar with that, Stephanie. And in those moments, we find things like performance strengths, character strengths, which I'm going to talk to you about in a second. We find processing modalities, the way people naturally take in information. We do it differently. We find all these kinds of things, and this becomes a positive context that replaces the old negative memory. But it has to be repeated over. We have to be vigilant. We have to be vigilant, but we have to be trained in this. So think about what I'm revealing to you. We can't do this in one moment. This takes time, but I'm giving you a framework that the ADHD coach understands the brain wiring. They understand intrinsic motivation. They understand positive emotion and what negative emotion can do. And we have sources of positive emotion that are psychometrically reliable and valid, called the VIA character strengths. And these are used by millions of people around the world, but it was never used for ADHD coaching until we brought it to the academy about 10 years ago. Okay. And we have actually done research on it. And why do we use the VIA character strengths? Because the VIA character strengths are accurate, reliable, valid markers of how people perceive themselves. And there's 24 attributes that all human beings possess, but we see certain ones in ADHD, one of the biggest being creativity. And so, how does creativity get expressed if you're always paying attention to negative memories that impair your ability to move forward? You can't. So, creativity and imagination are the highest rung of those four levels of engagement: inspiration first, and then imagination, because you need to be inspired before you can imagine. And what research shows is that people with ADHD are more creative than the neurotypical population. Divergent thinkers that look at different ways of doing things, multiple ways. And this is a huge strength of people with ADHD that cannot manifest if we don't get them to the place of where's your source of positive emotion. So we have these 24 character strengths that we ask our clients to take. Every one of my clients has to take these VIA character strengths or they can't work with me. I will not take them. So they do it. And why wouldn't they? And so when they go to that naturally ruminative place of that memory, when they go to make a decision on something and the negative memory comes up and they say, I can't do this and I won't do this. I say to them, well, that's interesting, Jane, because I've got your VIA character strengths right here. And social intelligence is one of your top 7. And so is creativity. And also, you gave me specific events that you did with this. And all of a sudden, in that moment, you've created a pattern interrupt where the emotion immediately changes. Because why? Because people with ADHD forget these positive memories, they bury them. And so, one of the things that we emphasize in our program is a positive psychology term called savoring. Savoring. And what that means is, as we go through life, all clients, especially people with ADHD, have done successful things in their lives, but even when they do it, they mark it off their task list and they go on to the next thing and they don't pause long enough to celebrate it. They don't pause long enough to savor it like a good glass of wine. You wouldn't want to gulp a glass of wine, you get inebriated. You want to sip it and savor it, right? Same thing with the things we do well. And when you savor it, savoring is critical for registering it in the memory. So, why is attention so important? Because if we don't know what we're paying attention to, and we keep paying attention to the same things, we're going to manifest the same things over and over and over again. And there's another skill we learned called the power of the pause, but I'll take that in a second. What we do as coaching is about a very objective, observant coach that is trained to be an outstanding listener of what the client is sharing about their ADHD in terms of challenges and strengths. And when the challenges come up and they exacerbate them, we're not going to spend a ton of time with that source of exacerbation. We're going to say, I'm so sorry you feel that way. Tell me more about it. We acknowledge it. And then we say, can we put that to the side for a few minutes? And let's put it in your schedule to look at it later, to take the pressure off. And they do. And the moment they do that, their brain is available. And I say, what about your character strengths? What about your magnificent me moments? What about all these things that you've done? And we break it down and dissect it so they can savor it, and we anchor it. We anchor it. We repeat it. So over a period of time, because the brain works on repetition, and we all know that one of the greatest discoveries in the history of mankind is the neuroanatomy of the ADHD brain is flexible and malleable. And we can change the architecture of the brain by what we pay attention to. And so people that have been paying attention 10, 20, 30, 40 years and on can change that in less than a year if they work at it. It's not a quick fix, but it's a great fix. And so we have this process where the coach that's from an accredited program goes through all these skill sets of creating safety with the client and environment by saying, I have an ADHD lens that understands your brain wiring. You're not broken. You never have been broken. What you have is a unique brain wiring, and we're going to find out how it works. And with that unique brain wiring, there are certain situations where it works well and what doesn't. What if you and I work together to find the ways that it works great, consistently? And what if we find the sources of positive emotion called your character strengths that you can access every day with specific memories that become your new context to make better decisions? And we do that every day. And what if we also can find out how you process information so that if you're working for a corporation and you have to do a lot of emails, you're not sitting there typing, you're using voice activated software because the cognitive hyperactivity, the bombardment of the thoughts is coming so fast you can't even access them. So we use assistive technology. And everything that I'm sharing with you is what a well-trained ADHD coach can do. And the last piece is this. If we're working with our clients to create safety in the environment, safety and trust, understanding how their brain works, and asking to collaborate, we don't tell them what to do. We don't make their decisions. We invite them to explore new ways of using their brain. And then we get them activated by bringing in positive memory. And when they're there, we can begin to say, what would that look like if you could have this outcome that you want? What would you like? What would be the first step that you could take towards that? And we move towards that. Now, here's the thing that makes this all happen. All this is wonderful and it takes time, but one of the most important skills that is not taught in school, that is not taught in training nearly enough, is what we call the power of the pause. Because ADHD impulsivity is so strong, because the inability to inhibit is so strong in the ADHD brain, we have to learn what is called emotional intelligence. And emotional intelligence is the ability to pause in the moment and identify a feeling in your body that's linked to an emotion. Nobody taught me that when any invisible thought you have in your head shows up in your body. Nobody taught me that. I wish I had known. I was 40 years old when I learned that, okay? Now, every time I feel something in my body, I pause and I identify the feeling. And that feeling will lead to an emotion. But here's the thing. People don't understand when you're stressed with a negative emotion, you have to breathe. You have to take the oxygen in. You have to take 25% of the body's oxygen in to be able to use your executive function, because the prefrontal cortex, that part of the brain that's implicated in ADHD, the part of the brain that identifies the emotion, that accesses all the different parts of the brain and the feelings and the emotions and the thoughts, if that's not available, you're going to be hijacked because the stress is so bad, your heart rate is so bad, you don't have enough oxygen. And so what I tell all my clients, in fact, right in some of our training programs now, Marcy, one of our coaches, 15 minutes before class, she did a mindful meditation with all the coaches and they loved it. All the stress went out of their body. And so what we have to learn to do as human beings is learn the power of the pause to identify the emotion. And as we're identifying, say, how's that feeling serving me? And change it, because all these feelings and thoughts are part of stories we tell ourselves. This is the final piece of the mindset that I'm sharing with you. What we learn, and to think about when you go into other programs, are they learning these kinds of basic things that we're teaching? Is that when we receive a client, we receive them with open hands and judgment, with compassion, and we witness them from a distance, objectively. We don't get emotionally attached because we're good at doing that for ourselves, and we have to learn not to, but we watch them and we witness it, and we witness to the language of the mind, the feelings in the body, of the story that they're telling themselves. And if that story, which is usually negative, we begin to ask them, how's that story serving you? We call that filtering out the negative story. And if it isn't, we begin to say, well, what story would begin to move you forward? And we start to developing a different story. And every time we hear the language of the old story, we pause and stop them and challenge them until they realize, because they realize the story isn't serving them well, but they've never paid attention to their bodies to get the signal of the feeling, and then have somebody talk with them about it. Why coaching is so important is because a majority of our clients are verbal processors. They verbalize out loud and they don't hear themselves because verbal processors are auditory. It's not the only kind, but a lot. What coaches do beautifully is we help them extract all the thoughts in their brain and reflect and mirror it back to them so they can begin to hear their story. Stephanie, you know this in your own coaching. How many of your clients have told you, I didn't say that? And you repeat it back, and yeah, you did. I wrote it down. And they can't believe some of these things actually come out of their mouth when we repeat them. So we repeat them, and then we kindly and compassionately challenge them to say, how's that story serving you? Let's work on a story that you can, because a new story activates the brain. And when we activate that brain, we begin to reinvent a new story through questioning. You know, what's possible with a new story using these wonderful strengths in your positive, magnificent me moment that they're just learning to access because the dominant negative are now diminishing. Okay. And when we do that, we receive them with compassion, we witness them objectively, we filter out the negative story, we activate them for forward movement, and then we pause and say, tell me, reveal to me, what's your new story going to be? And we activate that new story and we anchor it, because it's not about beliefs anymore. Beliefs are things that are handed down to you. It's about evidence of knowing. Beliefs, I was handed down a belief that you have to take care of everybody else but yourself first. That belief almost killed me. And to me, it was like I knew it, but I didn't challenge it. And so what happens is, no matter what age you are, if you live with ADHD, you're challenging a lot of negative beliefs that have been handed down to you by teachers, by all kinds of people, and they've never been challenged. And they're illusions. They really are, because every person has some greatness in them. And we as ADHD coaches know that the solution is in them. Okay, so that's the mindset. Now, what does this all mean? To create that mindset took 25 years of work. This didn't come. And so when somebody goes to a training program, even if it's ours, and after 1 year opens up a training program and says, I'm going to train you, that's doing damage to the people that are going to take it. Listen, they may get a few nice things that will help. A life coach can take an ADHD coach only so far. Okay. But there's nothing worse in this world than stagnancy. You can take a client so far, and when they hit the brick wall, that stagnancy is going to impair their ability. It's the worst. And that's exactly what happens with people who are not trained well in ADHD coaching. Life coaches can only take them certain place, and then they stop, and those poor people have nowhere to go unless they know of an ADHD coach that's trained. So why do I bring this up? Because the International Coach Federation is a life coaching organization. Um, um, EMCC, the European mentors, the European coaching community, which I love, and I think they're great. They've actually had me come and speak to them a couple of times. There are some good ADHD coaches over there, believe it or not, but and they promote training, but and the ICF does, but ICF life coaching accredited programs do not teach you about ADHD coaching. You have to go to an accredited school that specializes in ADHD coaching. In fact, we do both. You have to learn both. You have to learn life coaching and ADHD coaching. And because we're accredited by both, and one of the only two, you have the ability to work with both. But 90% of our coaches love working with the ADHD population, okay? Because many of us have it, or many of us has worked with it. So it's so important to know that it's not enough to have ICF accreditation. That's not enough. What you need is, my belief, and we know the best coaches are now coming out of ADCA and PAC. ADCA and PAC. Now, we have the most coaches that go through PAC by virtue of being the largest in the world, but PAC sets the standard for ADHD coaching. 3 years ago, there were maybe 20 coaches at PAC. There's 150 now, and it's going to grow fast because it's caught on. They have excellent competencies. They have markers. They have a process. And so this is what I'm going to tell anybody that's interested in training. It's virtual now. You don't have to be stuck in the country that you're in. If I know a good program in the UK, I'm going to promote them because I promote mentor coaching. I don't want to be the only training program in the world. We need lots of people, but I don't want poorly trained people going out there and doing stagnancy with clients where they hit the brick wall. It's the worst thing in the world. That's the first piece. Now, I also have some stats that I want to share with you. I didn't memorize them, okay, but I brought them with me. Catherine Sanders, a coach at ADCA, did some research. And here's what she found. And I think you'll find this very interesting. In the UK, over 1,200 people advertise ADHD coaching. Get this, 1,200 people, but fewer than 100 appear in accredited directories such as ADCA, ACO, PAC, even ICF. Only 100. Oh, no, maybe there's more in ICF. They may be life coaches, but only 100 out of 1,200. That is very common, okay? Let me give you one more stat about the UK. Only about 3 to 4% of UK adults, that's adults, I'm not taking children now, even though our program does children because I'm focusing on adults today, but it's even greater with children. Only 3 to 4% of UK adults, roughly about 2.5 million people, live with ADHD. This is a statistic that blew me. This wasn't even from Catherine. This was from research, PubMed, or one of those. Yet only about 1.8% have ever been fully and formally diagnosed. And for many, it takes up to 3 years, and that's good, just to get an assessment appointment, okay? Now, let's add another piece to this. Let's look at physicians in the UK. Most primary care doctors receive little or no formal ADHD coach training in medical school or residency. That is not just in the UK, that's in the US, that is global, okay? And this is what didn't surprise me either. It's very similar in the US. A recent UK study found fewer than 1 in 5 GPs, general practice, feel confident in diagnosing adult ADHD. Okay, so think about that. The primary focal point for the diagnosis and treatment, because this is a diagnosable bioneurological disorder. When the brain is put on a level playing field with the right medications, and if there's therapy needed, great. We're not, if we're not trained to do therapy, if somebody's getting stuck in a pattern, a ruminative pattern that they can't shift out of consistently, we're going to refer them to a therapist. It's comprehensive. There's a team, okay? And when you think about this, 1 in 5 GPs feel confident diagnosing with adult with ADHD, and the same with therapists. And then add to it there's a small number of psychiatrists in each of these countries that are trained in it, and their practices are full. Is there any wonder that you've got a backlog of people who are struggling terrible, debilitating, that are not being able to get diagnosed? Now, in the meantime, while they're getting diagnosed, ADHD coaching can be a great platform to get them educated, to work on other issues that they can move forward so that when they do get diagnosed, they've already done the cognitive pieces of how does my ADHD show up? Where does it show up? Because we are trained not to diagnose, not to talk about the medications, but we do know, and our clients tell us when the medications are working. And when they're working, they can move forward with a lot more effort. But there are some situations where the harder they try to push forward because of the neurology and because of the lack of neurological help with a stimulant in this case, um, they can't move forward because the boredom and the pressure is too high and their brains shut down. Neuroscience tells us, so we work on other things. Why should somebody be stagnant because the system won't allow them to be diagnosed for 3 years? So coaching helps them get there, but we don't have enough coaches. We don't have enough coaches. But that does not mean that you have to go get training because there's not enough coaches. Go for the best. Go for the best. Register for the best. Not only ours, go to Mentor Coach and look at what they have to offer. Reach out. We have Q&As all the time, and get in. Because here's what I'm going to tell you. This is a calling. This is not just a profession. This is a calling. And I can tell you, all the ADHD coaches that go through our program are highly, highly motivated. Most of them have ADHD. And the reason they're motivated because the knowledge they gained as coaches has transformed their lives. And Stephanie is one of them. And if we were sitting here, she's got great stories to tell you. I know them. I know Stephanie. I know what she was like before she got into training. And look at her now. She is like a perfect model of what an ADHD coach does for their clients. She does, but for herself, because we have to model for our clients. And she's done a fabulous job. And look at what else she's doing for ADHD coaching in the UK. It's beautiful. And so she's a primary example of what coaches have to do. But she will be the first to tell you, this is my calling, this is my passion, and I have a purpose. And so if this is a calling for you, if you feel passionate about helping people with ADHD, the one thing I'm going to guard you against, don't coach your family. Don't coach your kids. Don't coach somebody you know well, because it's very hard to be objective. It's very hard to distance yourself. Now, there are some exceptions, but I know I couldn't coach my kid because the coaching went out the window when he pissed me off, excuse my French. When he got me angry, I was not coach anymore. I was his dad getting angry. And that's what will happen. So don't coach your kids. You can educate them. You can help them understand their ADHD, but you need somebody independent to create that distance between you and your child. But also, you need to be coached by the coach because everybody needs to be aligned. So many parents don't understand the challenges of ADHD, and they are crucial to their child moving forward. All I will say to the parents on this call, find your kids doing things right. Shine the light on what they do well. Move it from wrong to strong. Move it every day, and you will see a change. And anchor it, because the home is the only place where you can do that. And that's it for me, Stephanie.
Oh, well, I don't know how to conclude with that, but yeah. Again, every time you speak, David, I think I kind of, it distracts me. I'm just completely just in talking to you now. I don't know what I meant to say because you always, it's so riveting, and we're so lucky to have you here. And yeah, again, so grateful because the landscape, it is troubling. Even just today with LinkedIn, I was talking about certified ADHD coaching and the importance of it. There was someone that was saying, oh, it's really challenging that coaching's not regulated. Coaching needs to be regulated. And so I felt I needed to inform this person that, hang on, there's ADCAR. They've been going around for, 25 years, accredited by ICF. So, and then shared the directory of the HD coaches in the UK because there was a directory of those. So
Yes, yes, I know.
important.
Yeah, yeah, yeah,
And a life coach came out and kind of challenged me on, hang on, well, a life coach a good life coach can do just the same. Yeah, and that's why I actually directed him to your video from last year. But exactly what you're saying now, I guess maybe just to kind of conclude, in terms of going back to in a nutshell, the kind of main points,
yeah.
how would I?
So let's talk about this one you just mentioned. Uh, 10 years ago, I had an outstanding master certified coach, life coach, come to me and tell me I can coach a person with ADHD just as well as anybody trained in it. I said, okay, go ahead and do it. And about 6 months later, she called me, and that person had hit a barrier. And I talked to her and I said, have you thought about this? Have you thought about this? Have you thought about this? And that person eventually came into training, and now she's an ADHD coach. Okay. So, yes. And I will also tell you this ICF, if that life coach, if anybody at ICF heard that life coach, they would be really angry at that life coach because ICF refers out to ADHD coaches. They do know that life coaches should not be coaching people with ADHD. They actually do, and that's a huge change. It's a huge change. They don't put it on their website, but they have a neurodiverse area. It's not the way it needs to be, but they are very, very aware that they should be referring out. And I guess the big thing to leave it out today, the point that I wanted to get across to everyone is the kind of training that we get. And, I did it in 30, 45 minutes, whatever, is specialized. And this is just a smidgen of what we do. But when Stephanie learned, she came in and took what I learned, what I taught you today, and made it her own brand of it. It's not like you're getting a template and you're a robot. You're learning the basics. It's like learning to dance. When you learn to dance, you learn the waltz, you learn the box step, 1, 2, 3, 4, one ad nauseum, and you do it over and over again. But eventually, you know it so well, you freelance. You
Mm,
start doing different steps. You take the dance wherever you want to go. So we're teaching all the steps and the fundamentals of the steps that say that I know how to dance with my client, but my client's got different steps. And if I don't recognize those steps, I'm not going to be able to dance with them at all. So a life coach who doesn't understand those steps is going to do damage. They may one day have the right steps because those steps are universal. But when it comes to the unique brain wiring, the steps change and they change dramatically. And if a person with coach with ADHD doesn't understand that and embrace it and accept it, like a life coach would say, well, that's weird. Why would you do that? Or that I don't understand that. The one and two things that we hear from our coach, from our clients all the time, and we've talked about this, Stephanie, is this is the first time that anyone understood my brain wiring. You're the first person that ever, and you're the first person to actually identify I have any strengths inside of me. Those are the two things that I've always heard from my clients is the strengths
mhm,
and challenging the story, but that I understand their ADHD. Inevitably, that happens to every coach with every client. But if you don't have that mindset and what we call the ADHD lens, that's what makes us different is we have an ADHD lens with specific skills that we're trained in that we actually measure. We don't let anybody go out until they meet these criteria. And we find ways to take the pressure off our clients and our coaches because you're going to do the same thing. Now, here's the beautiful thing about coaching you're not giving answers, you're not there to fix anybody. You're not there to repair anybody. You're there to collaborate with them, to listen to them, to find out who they are, what makes them tick, and invite them to bring more of that into their life, doing it their own unique way. So you never have to feel pressure. However, with that said, we grow up feeling like we have to, and it takes a while for coaches to not feel like they have to perform, to feel like they have to give value. The value is in the process, the value is in the skills, the value is invitation, collaboration, discovery, exploration. And then the client says, I get it. And
mhm.
then when they get it, you got to anchor it for them and ask them how they're going to remember it.
Yeah.
because they'll forget. So all these are pieces that you learn. And so I want people to understand this philosophy so that when they go to a school, they can think about these things. Well, what kind of ADHD lens do you have over here? How do you work with your clients? Um, are you the first thing is ask if they're accredited. If they're not, it's up to you. I don't recommend it. ICF has accredited programs, but there are very few that do ICF and PAC. And so I've been at this for 25 years. It's finally, thanks to people like Stephanie, I would say in the last 5 years, PAC is just starting to get known because ICF is so big. Think of PAC as the ADHD ICF. That's what they are. Okay. And so those three things, accreditation, certification, ask them what they're go look at our curriculum and compare it to somebody else right on our site. Come to one of our Q&As or come to Mentor Coaches Q&As. It's on the site. Call, ask for me, ask for Caroline McGuire if you're interested in the family. We're very open. And Stephanie will tell you, here's the last thing. When you come through our training program, when you get certified, you don't leave the family. We're always there. Stephanie graduated, I don't know, 3, 4 years ago, and here I am. She reached out and I said, absolutely. And we do this with our coaches because we love them. They're great and they're making a huge difference in the world. I don't know how many hundreds of thousands of people that we're helping, but we have so much more to go. So much more to go.
It's incredible, honestly. It is like, yeah, we do this values exercise and we have to identify, who's inspiring us and what, yeah, and you are obviously up there, always have been.
Oh,
We transformed my life and, enabled me to make the impact and the outcomes help, other people, ADHD is, I can't even talk. You literally tongue-tie me, David.
I'm so sorry. I hate when that happens to me.
Honestly, with you, I am because it's like speaking to like literally the godfather of HD coaching. So I get tongue-tied.
Well,
But
thank you.
so much gratitude and the impact that you're making. That butterfly effect is just, yeah, can't conceive, can you? You just don't, you wouldn't know, right? Really how far that impact goes. So
Yeah, and we're working on some things in the UK to make the public aware of it. It's going to take some time, but we're working with some psychologists and professionals that understand the power of the power of the team, a good therapist, a good diagnostician, and a good coach, and working together. And it's lovely because when the professions work together and embrace each other's skills, that's what our clients need. That's what they need. And so it's happening. And I love the UK, love the people in the UK. They're great coaches, great people, and it's expanding. So I will be talking to lots and lots of them, especially you, Stephanie.
yes, no, and I'd love to have a catch up, just you and I soon for sure. That would be amazing. But thank you so much. Thank you, David.
My pleasure. All the best to everybody and all the best to you, Steph.
Thank you. Bye.
Bye.
Yes, so we've just heard from David there. As you saw, embarrassingly, I got tongue-tied. Doesn't happen. I don't know the last time it actually ever has happened when I'm speaking, but you can understand why no one in the world gets ADHD like he does, is able to articulate the ADHD experience like he does, and in terms of the importance of ADHD coaching, particularly certified ADHD coaching. No one else can explain the way he does in terms of why it's so important that an ADHD coach is certified because there are obviously that lens, that ADHD lens is just crucial. So, Ruth, I know we're a bit early, but I figured perhaps I'm gonna get you to turn your um, start because I think as well, kind of Ruth, you coming in now after David has just spoken. Hello, Ruth, how are you?
Hello, I'm fine, thank you. How are you?
Yes, good. I just thought it's perfect timing, really, because David, as you probably just heard there, was talking about the importance of having that whole team, you know, around the ADHD. So the certified ADHD coach, psychiatrist, but obviously, the therapist that understands ADHD is so important. So
Mm.
very timely. So did you want to maybe introduce yourself firstly to everyone on
Yeah.
the webinar? in the summit.
Okay, so my name's Ruth Dines, and I'm a therapist in private practice in North London. Coming into it about 10 years ago after a career in management consultancy. So I had the corporate career, and then I decided to do something like this, which was a wonderful move. I'm also a tutor at a college in Hornsey at CPPD, where we teach um, students to become therapists. It's a 3-year course, and I teach the middle year, which is the diploma. There's a certificate and there's an advanced diploma. So I'm one of the tutors there. So I see people in private practice and I also tutor.
Fantastic. So, and Ruth and I came across each other actually not directly in terms of our professional partnership, but through your daughter, Lauren.
Mm.
Yeah.
Yes, I live with someone with ADHD, and my best friend's got ADHD, and family members have got ADHD. So I'm around it a lot.
Okay, so that's the thing. You are an ADHD informed therapist, which again, and I'm sure you've got stories, I've got stories in terms of when we've got a client that comes to us that has received ADHD informed therapy versus a therapist that doesn't know about ADHD and some of the unintended, consequences that that can have on the client, on the ADHD, because of the maybe unachievable expectations, not being able to look through that lens.
But that's an interesting one. I mean, can I ask you more about what they've said to you about informed versus not informed?
Okay,
Because I think
yeah,
that's
no, of
quite
course.
important.
So what we found, and I guess again, kind of like in terms of what David was saying, in terms of the certified HD coaches, that lens being crucial because I've had a few clients that have come that have felt kind of more guilt and shame in terms of, for instance, if the therapist is doesn't understand that, for instance, ADHD makes it difficult to do forms, to complete forms and things like that. And so with some therapists that want them to do these exercises or they need to do these, prep forms beforehand and they're not getting done, um, sometimes therapists might kind of push, so how come you haven't done it? How can we get you to do it? So, and then it kind of might just reinforce or, that negative narrative that that client has because they don't understand that it's because of their ADHD that this is difficult. And so they're not in a position to be able to communicate to that therapist, because of my ADHD, I'm going to be really, forms I'm not good at. Can we maybe do the update in session as opposed to you expecting my form every week? Because every time I don't do it and don't get to you, I feel like I'm failing. And so therefore, I shouldn't actually be doing therapy because I'm not doing it properly. Actually, we get that a lot.
Yeah, and I've got a great example actually from my clinical practice of a client who phoned me and we had a chat and they said, I'm sure I've got ADHD, haven't been diagnosed yet. I want to come and see you and I want CBT and I want you to sort this out in 6 to 8 sessions. And I'm like, no, that's not going to work because if someone does have ADHD, I have to think about my approach and my intervention, the modality. So, am I going to do CBT? Am I going to do person centered? Am I going to do Gestalt? And at the end of the day, as you've rightly said, for someone who has ADHD, having those forms and having to follow a linear process each week can make them feel even worse than when they started therapy.
That's
So
it.
we have to know. That's why I think the ADHD lens is so important for the therapist because they understand what approach is going to work. And are you going to give the client more shame and frustration from your approach if you don't understand what it presents with? And of course, and I know ADHD presents in adults in lots of different ways. So it takes a really experienced person to understand what are they presenting with.
Yeah, it's the other thing I was going to say as well. Actually, my daughter, who's neurodiverse, she was seeing a therapist, and however, I think I've forgotten what type of therapy this was, but it's the therapy where you say something like you give a long pause. So even if someone has said something kind of positive, there's still this long pause. And what my daughter was finding, she's feeling quite judged, and her RSD rejection sensitivity was triggering. Am I supposed to say something now bad about this? I just told you, my friendships are going fine. But then this long pause, and so she's like, what? Are you doubting me? am I, and she didn't want to go to therapy anymore because of it. Yeah, I'd love your take on that. And what type of, there is a specific therapy where they do, I think you hold a long space.
Well, there's so many different modalities. There's person-centered, the Gestalt, there's psychodynamic, there's psychoanalytical, there's transactional analysis, there's existential, there's a whole umbrella of therapies. And then what I train at college, my students, I'm integrative. So I like to blend a number of different therapies to actually have that toolkit. So I think that work made a really good point, because a lot of clients will find silences very shaming or very awkward, especially if they've grown up in a household where you're punished by actually not being spoken to, or you're sent to your room. So one of the key things that I hear clients say to me is, I didn't like the last therapist. And there's lots of reasons why, and it can be fit, nothing to do with the therapist or the client, it's just fit. But what they will say is that the therapist didn't say anything, or they didn't come in. I wanted a different approach. And so, what I say to clients the first time they feel comfortable, if the session resonates, because you've got to find the right fit. But I absolutely agree, having silence can be very difficult for some people. And it's, how do you make the client feel safe, secure, held, and understood? And silence isn't going to do that for a lot of people.
Yeah. So it sounds like, again, it's about, like with the coaching, the dance, in terms of being able to meet the person where they are. And that might take a little bit of, okay, maybe don't go there. Maybe do it this way. A bit of testing and measuring a little bit. Bit of testing and
Well,
measuring.
it's about attunement. It's all around attunement. And if we look from the very start of the baby's life, we want the caregiver and the parent to be attuned to their needs, their moods. What are they asking for? And it's the same in therapy, because we offer often with, let's say, a client who's had a difficult childhood or has issues with their parents, we're offering a reparative experience. And in order to do that, we have to be attuned to the client's needs. So if you take a person-centered approach, it's about client-led. What do you want to do in this session? It's not directive, it's going at the client's pace, it's being attuned to what they need. And it's very different at the start, where you're making the contract and you're building the relationship, to what happens throughout the rest of the therapy, once you've got your relationship established. But it's all about the relationship. And actually, all the studies show that it's actually not the modality that makes an impact. It is around the relationship. However, what I would say is things like CBT are phenomenal in the right setting with the right client. It's not going to work for certain clients, especially if someone has that cognitive processing that doesn't match what the therapist is looking for them to do.
Yeah.
And for example, when I teach CBT at college, what I say is we have to give clients, when we do CBT, work in between the sessions. 50 minutes once a week is not going to make a difference. We have to work with other behavioral techniques, interventions. But we don't call it homework anymore. We call it assignments, because, of course, homework can have such a negative impact on some people who, with ADHD, may have struggled at school, been bored, not been able to focus. So having homework will immediately trigger them in some clients. So that's why the attunement and the ADHD lens that the therapist looks through is really important.
That's a really good point. And that's what David was talking about as well, in terms of the words that, we use, the words that certified ADHD coaches know what to use, but potentially, if there's not that understanding through the ADHD lens, the words can cause quite a bit of damage, unintentional damage, because particularly with we found the ADHD is with autism, words can really pack a strong punch because of RSD.
And that's if I can come in here, that's an interesting point, because I think having a therapist who understands ADHD is important, because our clients can present with a range of issues. And actually, we have to understand, is this depression? Is it autism? Is it some sort of personality disorder? Is it anxiety? Where do these, and they overlap sometimes with ADHD.
Definitely.
So understanding what ADHD can present like, symptoms, the impact, the consequences, means that we can more target what's going on for this. Is it ADHD, or actually is it comorbidity with another thing like anxiety and depression? So you're treating the right thing. And if you don't understand about ADHD, then you might think this is depression, you might think it's anxiety, but it could actually be ADHD and it's symptomatic of anxiety and depression. Because who wouldn't be anxious or depressed if you've spent your life not being understood, heard, being called lazy? Do you know what I mean? So
Completely.
that lens is so important to be able to separate what else the client's presenting with if they are.
Yeah, you made another good point actually in terms of the role, why it's so important the therapist is ADHD informed, is because I've had a few clients that have come to coaching having been diagnosed with ADHD because their therapist has suggested they may have it. So the therapist was the gateway. The therapist was the reason why they got that ADHD diagnosis, which again, obviously, transformative for them. It was that therapist that enabled that for them. So that's huge.
And it could be, I've had clients in their 40s, 50s, and 60s come to me. And like, we're trying to make sense of what's going on in the world. And to be told that you might have, because I can't diagnose ADHD, only obviously a psychiatrist or someone clinically trained can, but I can look at what they're presenting with, the symptoms, and I can have this suggestion to think about, could it be this? And that can be so life changing, because for the first time you might feel understood and actually heard without judgment or criticism of what's going on for you. And that's why one of the most important things for me as a therapist is to just hear my clients' lived experience of what they've had to go through and how it's impacted them.
Yeah, do you find, because again, David was saying, and we've seen this as well, that difficulty that ADHDs have in pausing to process how they actually feel, right? In order to kind of work back and go, I feel like this because I'm thinking this, or this is happening. Quite often, particularly if there are childhood adverse experiences, and there's a lot of intergenerational, right, ADHD, the parents, and unfortunately untreated ADHD.
There's a big genetic link, isn't there?
Yeah. And so there can be trauma as well. And so a lot of the young ones, ADHDs, when they're young, you kind of just start to just be fine. I'm always fine. I'm not gonna, I'm gonna ignore how that's making me feel. I'm just gonna not like feelings, how I feel. It doesn't matter, irrelevant, right? And then, and if you start that early, very young, and you just keep carrying that all, have you seen that a lot with the ADHD is that you see for therapy that also maybe there was some trauma?
Yeah, I mean, first of all, let me just say, I don't do children under 18. So I just want to say, but what I do see is a lot of parents who come to me who've got kids with ADHD. And obviously I've got, as you know, a daughter who had it as well. And I think one of the issues, I think you're asking, do they learn not to feel? Do they learn to mask it? Is that what you're saying?
Child, it never changes. So if the narrative, if you as an adult kind of formed this narrative that you're always fine and you don't check in with how you feel because there's nothing you can do about it anyway, so you just keep going, things like that. And the child then grows up obviously into the adult and keeps doing the same thing because it's a coping strategy they adopted. They don't know anything else. And so they just continue. Yeah, do you
Yeah,
see?
no. Oh, yeah, yeah. I mean, look, in a broader sense, if you take away the ADHD, I have a huge number of clients over the years who don't want to feel. Because actually, to feel, if you've had adverse childhood experiences or bullying at school, and there's so many different things, or a parent you've been scared of, these all can be very traumatic. So for a lot of people, kids growing up, you learn not to feel because it's difficult and it's uncomfortable. If you add on parents who say, if you're going to cry, I'll give you something to cry about, or, boys don't cry, or girls have to be people pleasers. So you grow up with this, what we call the script.
Mhm.
of how you need to behave. And you know what? Babies learn it from birth. They learn to look at what their parents' mood is. They get the sensory stuff. So they know very early on whether they can feel, they can be upset, they can cry. So of course they close down how they feel because it's safer.
Yeah.
Or they actually have to not allow themselves to be real. They mask. So of course this absolutely happens, probably even more high powered with people with ADHD, because you may have got the message, you're lazy, you procrastinate, you're not taking notice, you're not focusing. And so all of that shame, embarrassment, frustration, who wants to feel all that? So actually you learn to disconnect what's going on here. And that's why we get some clients who tend to ruminate a lot or get anxious in their head or overthink, because it's easier to do that than it is to feel this. But unfortunately, the body will hold the score and the body will remember. See, the body will often tell you the head doesn't want to face.
And that's what
Irritable bowel syndrome, fibromyalgia, all of these things often can be linked, not always, but can be linked.
Yeah, it is quite common, like the fibromyalgia and sometimes unexplained kind of conditions, pain, chronic pain, right? And they go to the doctor and the doctor can't find anything. Yeah, and that's
Yeah.
yeah. So it's yeah, like what David was saying again, it is so important to be able to pause, to process. But again, if that's not a habit, if your whole approach has been to ignore the body, keep going. And a lot of ADHDers do that. They can ignore the body. They're, like you said, they stay up here. They're so here that they don't know what's happening with body, which is why they also get sick quite a lot, because they ignore their bodies and just keep in their heads. But
We
always,
say, Stephanie, sorry, we say just on that point, we say if you can't feel it, you can't heal it. And I know it's a bit glib, but it's actually quite true. If you're not feeling, how do you start to heal it?
yes, that is a big problem. And I think that's also another big reason for ADHD. Well, a lot of ADHDs are vulnerable to toxic relationships, to abuse. Precisely because, right, again, if you're not stopping to think about how you feel, if your feelings are kind of irrelevant, if you've already kind of decided that, and then you get caught up in a relationship where actually that's great because this other person, they need to come first, and you don't matter. Uh,
And linked to that, if you work psychodynamically, which is going back to the childhood, that approach, you see, people find these relationships partly from what you've said, of course, but partly because you've been raised to think you're lazy or you're not good enough or you're not trying. And think about the impact of that on a child, about their self-esteem, their confidence, how they see themselves in the world. And so what you've got is that also, well, I'm not worthy, I'm not good enough, I'm never going to make it. Because that's the mirror that you've had been held up to you by whoever, school, family. So actually, I'm not good enough. And that's a deep core belief that's laid down in childhood that I spend as a therapist so much time trying to work through. What is the core belief about yourself? And with ADHD, there's going to be, again, it's going to be even more powerful, isn't it? That message you get sometimes, unless you have someone who understands it.
Yeah. I mean, what other kind of messages, again, do you see, so with women in particular with ADHD that come to see you, do you find that they are getting into these kind of unhealthy relationships because of their low self-worth and yeah.
Oh, yeah. I mean, the low self-worth and low self-esteem can come from a variety of factors. ADHD, to be fair, is just one, but it may compound what's already going on or accelerate it. But yes, I mean, especially with ADHD, when I see some clients who are older, especially, you know, they've never been seen or understood. They've just been misunderstood, shamed, criticized, not heard. Think about all those messages, especially in the school system, what school used to be like. I mean, gosh, the difference when our age group and even younger were growing up. So to have that shame, about not being good enough, not focusing. Because, ADHD, you do get bored. You can't focus in the same way. School isn't actually been designed very well for people who are neurodiverse. It really hasn't understood. America got on this, I think, much, much before us in terms of just letting the older students start later in the day because the brain's in the morning, the sleep pattern changes. But we've really not actually had a school or educational system that has adapted to the needs of this population.
Yeah, and as a result, like we're seeing the massive mental health crisis, so many more kids refusing to go into school. Like, yeah, hopefully, and it has to shift because the government's also running out of money. These EHCPs are generating, multiplying, well, trying to, but there's no funding. It's all running out. Same with access to work and the funding for, disabled people, ADHDs, people with autism, neurodiversity to be able to stay in work. The funding is running out or being taken away from people that have had it. So then now they've no longer got the support that has enabled them to stay in work. It's a bit of a crisis point at the moment from what we've
Yeah,
seen.
it is, and if you add in things like the cannabis use, I mean, this is just really making everything so much worse now, smoking and all of that because of the effects on the brain.
Oh,
Um,
the vaping and
yeah,
because the young
well,
ones,
no, not vaping. I mean, I don't. The studies aren't there yet. I don't know about vaping because it's quite new. But if you look at the cannabis use and smoking weed, that really is causing a lot of damage to the young brains because the cannabis we had 20, 30 years ago, it's now 6 to 8 times stronger.
really.
So yeah, so and there is this link now, this very strong link to psychoses that they're finding. So if you take that and then you take social media and
Mm,
how our brains have had to change because we're on computers and phones so much, the wiring and also the comparisons, you lob all this in as well, and you can see where this mental health crisis is coming from. It's so many different areas. I don't know what you see in your coaching, practice, but all of those together is making a big crisis here with less funding.
yeah, no, it's yeah, similar thing in coaching. So in terms of kind of what you would do to help an ADHD again, say there's the low self-worth. I mean, what in addition to the low self-worth and self-esteem and the inability to pause and check in with how they feel and what other issues would you say mostly come up for for you when you're treating an ADHD?
Mm.
What other issues do you
I
now?
think I think we've covered, you know, sorry,
Yeah, I guess because
sorry, it just went off.
sorry. Yeah, what I mean, obviously there's the how do you actually I know. What about the rejection sensitivity? Because RSD, rejection sensitive dysphoria, is such a huge part of ADHD. So in coaching, it's interesting to maybe talk about and for people to see how, the coach and therapist could work together on something like that, for instance, because RSD, from what, yeah, is like one of the most, it's the most crippling trait I've seen in terms of, with employees working, those executive function difficulties, yeah, they might get in the way and there might be deadlines that are missed. And however, it's the RSD that results due to those kind of challenges that really kind of makes the mental health deteriorate or that they have to literally can't stay in that workplace, that office anymore, have to go home. I had a doctor, which actually that happened to, RSD triggered. And I think she was oversharing or something. It was just, another an ADHD trait that obviously made her feel quite guilt and shame around, and she was made to feel RSD, and she had to leave. She left the hospital, and but because the hospital didn't understand that it was the RSD, they said, "Oh, you're having some kind of mental health kind of breakdown," and they wouldn't let her come back. And she missed all this like medical training, and she was trying to, tell them it was, I'm okay now. Like I had an RSD moment that triggered, and I had to get out of there. But look, I'm all right now. But they wouldn't hear it. No, your mental health, yeah. So it's an interesting one, that one, isn't it? And for us in coaching with RSD, the first thing we do is the name it to tame it, in terms of the fact that it's wired in the brain. It's not something that CBT actually can really address, particularly in the moment, because when it hits, because it's kind of wired into us, it will hit. And Dr. Dodson, so this was Dr. Dodson's work in the US, where he came up with rejection sensitive dysphoria, realized that's what was going on. And he suggested certain medications like I think it's quanfacine, fluoxetine, were the suggested medications for rejection sensitive dysphoria. But because it is such a widened thing, you can't quite access CBT in the moment that it hits. So the naming to tame it so it doesn't just completely floor you is so important to be able to then try and get to a state where you can talk yourself, or help someone help you talk through it.
Yeah, I mean, you're right. The rejection sensitivity is a huge part,
Mm.
as is when I see clients. It's the script that they've said about themselves. So it is the low self-esteem, the low confidence, depression, anger, frustration, being othered, feel like being on your own, not normal. So there's such a range of things being presented. And what I have to look at is with the big picture. So what's been going on in their life? What's the childhood experience? What's been their formative years? What's their attachment style? And so we start to see, what is this around with the ADHD, and what may it be different from that? So who am I with ADHD, and who am I apart from ADHD? That
Mm.
can be the hard work too. But I think in the initial stages for me, what we're looking at is just making the client feel heard and understood, acknowledged, and just feeling safe, to then start to go into how's it impacted me. And that's going to be really, like you say, really deep work.
Mm.
But we can also work at the same time, and we can do CBT here, about how they give meaning to different things,
Mm.
looking at their thinking patterns. So, for example, if someone with ADHD who's had a difficult schooling and difficult family background, they may do things like catastrophizing. They may do fortune telling, where everything's always going to be awful, blaming, it's always going to be my fault. So we can look at thinking patterns, and we can start to work with those so that they can capture them. So, for example, if a student's going to catastrophize, it's all going to go wrong. We can look at evidence to say, how often is this true? Let's reframe it.
Mm.
And let's reframe it from what's all going to go wrong to actually how much has gone right, how well you've done to get here. Let's reframe that. And I think the rejection dysphoria it's another layer, isn't it? It's there, and it's another layer, and it's also in its own space.
Yeah.
So I think for me, there's a process, but I think at the beginning, Stephanie, if someone's just been diagnosed, of course, it can make incredible sense to them that this is what's been going on. I understand it now. And I think, again, having the ADHD understanding as a therapist means you can do the psychoeducation.
Mm.
So you can explain that actually this isn't your fault. This is the way your brain's wired. Your prefrontal cortex is your executive functioning. It's your management of your brain. It's your CEO in business terms.
Mm.
And actually, yours is wired differently. And the studies show that an ADHD brain is probably 2 to 3 years behind in terms of development sometimes. So we can explain actually the impulsivity, the focus, the concentration, managing actions, looking at consequences, emotional regulation. These things are different in your brain. This is not your fault. This is not something that you could change without understanding. So to have a therapist who understands about that, we can do the psychoeducation, the limbic system, the nervous system, always being on edge because I'm scared I'm going to get it wrong or I'm going to get into trouble. So we can do the psychoeducation. The other thing we have to do, Stephanie, and I think people sometimes forget this, is we have to let the client grieve. for the life they maybe didn't have that they could have had. So it's a bit of a dual process, understanding what's gone on, and then the grieving for what they've lost, and then dealing with how do we have interventions? How can we help them? What's therapy going to do?
Mm.
Along with the coaching, because I think it's a multidisciplinary team. It's your psychiatrist, it's your coach, and it's your therapist. If you can have all three, well, you need a
Yeah.
psychiatrist to have the assessment. If you can have all three, you can be held for the first time
Mm.
properly.
Yeah. David was saying, in particular with that emotional dysregulation, obviously, therapists, you're trained specifically to help people in terms of emotional regulation, whereas, yeah, us coaches, if we do see someone that's too emotionally dysregulated, and sometimes that can happen if the client comes in and, they're completely overwhelmed, even sensory as well, perhaps like, that everything is, you can see, like I've been in sessions where I'm just, okay, not coaching today. How about, you should go to therapist, like, or the psychiatrist. Yeah. And that's really important because and this is what we're talking about with David in terms of the importance of being a certified ADHD coach, because you've got to know your limits and boundaries. Because, yeah, you could do some real damage as a coach trying to, hey, I know what works. This what works for me. Try doing this. Like, that's not my wheelhouse. I'm not going there.
Yeah,
Yeah.
same for me. I'm not going to take a client on unless I really understand. So I don't do addiction. I don't do under 18s. There's certain things that I won't do because I don't know. And I think you can do way more damage. And I think you have to have, as a coach does, and me, you have to have the humility and the honesty and the ethical practice to say, actually, this isn't the right client for me.
Yeah. Yeah. Because
I refer on for some clients. I say, do you know what? I think you're going to get more focused, experienced help with another therapist who does this. And so I think it's really important that we know what we're doing here, especially with things like ADHD and anxiety or panic attacks. These things, you can make them worse.
oh yeah, I mean, in the past, for some reason, it was early on actually. A lot of clients with ADHD. Well, we know the statistics, right? The what's at stake when ADHD is not treated. The fact that suicide, substance
So
abuse.
much.
Yeah,
Marriage breakdowns, social relationships, work relationships, interpersonal. I
yeah,
mean, the list just goes on of the risk taking,
yep.
gambling, eating,
This-
smoking, drink, to excess because they're needing that dopamine hit, aren't they? And so any way they can find it.
That's it. And the stakes are high. And there can be sometimes the ADHD could be in very, very low state, like you said, depressed. And you got to be careful, like as a coach, right? If you're giving them something to do or, and there's some, with coaching, there's also time sometimes for certain clients in certain situations you become more more pushing people into discomfort zone, obviously very measured, it's kind of just like um however, if you're not experienced and if you're not like and if they are that in that kind of state, I mean, you could do some serious and that's why it is so scary, that coaching is unregulated, that there are quite a few people once they get diagnosed with ADHD, I know ADHD, I can do this, but whoa, no, even when you are certified, it can be tricky. You got to be careful. Like one word, one suggest, like you think that for other, even other ADHDs and exercise, like maybe reflecting on something, and journaling, whatever, could be okay. But actually, because of the emotional dysregulation, because of like what David said, like what as well, past memories, like some ADHDs or DHDs, they report being able to they get stuck in like the past, literally get stuck in the past, and like it's a movie that plays that they can't get out of. And I've heard stories where a coach has said something, right, and triggered like a ruminative state, and that client has been on the brick, like literally has been ruminating in their room all weekend over, this thing that they've been tasked with. It's horrifying, and hasn't reached out, hasn't said to the coach, oh, look, I can't do this, because obviously they want to please the coach. This is what they've been told to do. Yeah, it's scary.
Yeah. And I wonder, it's an interesting, I don't know the studies, but if you've grown up with ADHD as a child and you've had that shame and you know, that response that's not been attuned or supportive or highly critical and shaming, what you do is you respond in a number of different ways. So you can go fight, flight, freeze when you feel threatened, but you can also go to fawn, which is like the people pleaser. So
Yeah.
the child will try and please mummy and daddy, and they'll try and do what they want, and they'll try and fit in, because the most important thing for a child is to feel they fit in and they belong. So we'll do anything to belong, even give our own needs away. And kids learn to do that very quickly. So what are the consequences of that as an adult? And I had a client today, it's the people pleaser, having to always please others, because it's an automatic response. You feel threatened or upset, I'll people please. So you go into that form. And of course, for the clients in the room, like you say, sometimes we have to, as therapists as well, be more directive and maybe more challenging. And how does that land on someone with rejection dysphoria? How does that land? So we have to know how far we can go, and you have to understand the difference between ADHD or if someone's being resistant or they're just not in touch with what's going on. It's complicated, and I think we have to accept it's complicated. And as a therapist, I may sometimes get it wrong. I may go in too early. I may not pick up a thread. And then what's that going to be? That rupture in the relationship. It's going to be much harder with a client who's got ADHD, possibly, with the rejection, the fear of it.
Yeah, that's true. And that's, I guess, and again, in terms of the coaching and why it kind of works very well with clients with ADHD is because, a coach is not telling anyone what to do, or not meant to be kind of assuming and remarking, oh, you're doing this because of that. They're not meant to be kind of doing that, leading kind of questions. And so you got less chances, obviously, to get it wrong in terms of, assuming something that's not the case, because like you were saying, the relationship is so important. And if, for instance, you've misunderstood, like, that client, for a lot of ADHDs or ADHDs in particular, it's that, oh, they don't get it. That's it now. Yeah, no, that you got that wrong. So therefore, nothing that comes out, you don't understand me. Nothing that comes out of your mouth is actually going to be accurate and apply to me. You don't get it. And then, that must be really difficult as a therapist, because obviously, you provide more advice based on, you're trained in certain techniques, I guess.
We don't, I mean, we don't give advice as such, right? Except in major certain circumstances where I may think someone's really in danger.
Yeah.
Let's say from a partner, then I may say, look, I really think I need to share with you what may be helpful here, or what you need to think about. So, there are exceptions to that. But we don't give advice, but we will help the client to come to where they need to be. And there may be interventions with, have you thought about this? What would it feel like to do that? What are the consequences of doing this? And what are the consequences of not doing it?
Yeah.
So, we have to work, it's collaborative. We're working together here. And what I try and do is minimize that hierarchy of, well, you're the therapist and you know everything, and I'm the client and I don't. That's old. That's old hat now. That's done.
So it
I
is
mean,
more
it's not like that's. We need to flatten the power differential that some clients may see or feel, which is why we have to take in so much around what's going on in the world, diversity, different cultures. So yeah, most of the time I'm not the expert on the client. They're the expert on themselves, and we need to help them get to where they need to go. With something like ADHD, I will have my list of what may help. And that's where we hopefully work together, which is, looking at diary management, looking at routines, looking at making sure you do your lists. breaking down big tasks into little manageable chunks. Like I say, don't look at the whole wall, you won't climb it. Look at each brick because it becomes overwhelming. So there are things, particularly with things like ADHD, where I will be more interventionist and give ideas. And that hopefully with coaching together makes that holistic approach.
Yeah, yeah. I was going to
Makes
ask.
sense.
Yeah, no, it does. It's interesting because again, yeah, therapy is evolve, changes with kind of all the different approaches. I've seen a lot of, I think there's actual kind of coaching therapy blended style approaches, like official ones. Is that the AC? What's ACT? Is it AC? Am I making that?
Uh, Well,
Act?
that's a different modality, unless that's the name of a coaching company. That's
Uh,
acceptance and
yeah.
commitment therapy. There's
Oh,
acceptance and commitment therapy, which is one strand. That's like the third wave now of CBT, where there's CBT has evolved into now more mindfulness,
yes.
spirituality, acceptance of where we are,
Mhm.
learning to regulate emotions. So there's dialectical behavioral
Yeah, definitely.
therapy, acceptance development therapy. So there's quite a few now, which has taken the traditional CBT as talking therapy into where we are now, which is spiritual, the mindfulness, learning to accept who we are.
Mm,
This is who I am in the world. What does that mean? Because it might work for you actually to be like this. It just doesn't work for others. So where do you want to be with that? So there's a lot of new third wave CBT therapies, and as I say, the mindfulness. And I think it's a blend of what suits this client. So every client, when you've seen one client with ADHD, you've only ever seen one client with ADHD, Stephanie, because everyone's different and they'll present differently and they've got different backgrounds, experiences. What meaning do they give certain things? It's going to be different to our meaning. So that's why I always say when someone clients, I love my husband. What does love mean to you? What does that mean? So I think it's always important to we okay.
yep, no, we're good. We're good.
Yeah. So each client, it's bespoke. It's about what they're bringing, our relationship, and what suits them.
Yeah. Yeah.
So
Does say, which does sound similar. There is definitely a crossover, which is good because this is the approach that works. So could I ask I mean, as you said, their ADHD is they are, no two are exactly the same. However, there's definitely fundamental issues under, for all of them, like we talked about in terms of, that kind of low self-worth, self-esteem, yeah, the kind of overwhelm, anxiety. So, yeah, just in terms of what you've seen and what you've helped ADHDers with, kind of what advice would you have from that perspective for, particularly parents with ADHD that might have children with ADHD? What do these parents need to be doing?
yeah, it's an interesting one because I've got quite a few clients who come in and talked about they've got to take the kids for an assessment. So off they go and they come back and they go, Ruth, I've got it. I've got it. And so the parents find out by having to be obviously, because, parents or someone who has to also give their view or opinion about what's going on. And so they'll come in and go, I've got it too. And so I think then you've got to try and get the client centered, calm, regulated, all those things you're going to do. And because the best thing you can give your kid is you be a role model for how do I do this? How do you stay calm? How do you hold them? How do you manage frustration? How do you manage anger? How do you manage when things don't go your way? I mean, you are going to be the role model for your kid. So actually, it starts with putting the oxygen mask on you as the parent. Yeah, because also, clients can come in and they can blame everyone for what's going on. They externalize it. If it wasn't for them or if it wasn't for this one or I would have been different. And that's really important to say, and another sort of analogy is you're going to have to stop looking out the window and we're going to have to start looking in the mirror because actually we need to look at you and what's going on for you. And so getting the client to stay with I,
Mm,
not you or them. can be really helpful, because then they can see what's actually being role modeled and passed down to the child. What mirror are they holding up to the kid? I've got clients who are sort of very much the procrastinators or perfectionism, which we know perfectionists
Oh yeah, it's a
comes
big
along with this.
birthday.
Which what do we call perfectionists? I say to my clients, I said that's the happiness thief, perfectionism,
Yeah, very
because it
true.
robs you of ever having good enough. Or so
Mhm.
we have to look at how's your child. What would your child say about you if I asked them to describe you? What's your impact on the child when you do that? How would they describe you? And so we have to work with the actual client and what they're presenting. But the other thing is, definitely, just as a general, a client may come in with a presenting issue, and 2, 3 months down the line, it's not what's really going on.
Yeah.
It's other stuff underneath that. But it can be really scary to name what's going on underneath, because once you name it, it makes it true and real. So it's easier to actually talk about other stuff and avoid. You know, Again, we go back to attachment style. Are you avoidantly attached? So you're going to keep away and keep a distance. Are you ambivalently attached? So you're going to get needy at times and then pull away. Is the chaotic attachment, where trying to work with this client is like trying to herd cats, nail jelly to the wall?
That's like
So,
sorry. That's like ADHD coaching.
oh,
Come, no, we'll talk about this, off they go.
yeah, oh yeah, I have clients the same way. It's like, in the first 10 minutes, let's just settle here, and what is the most important for you, what's bothering you. But they're all over the place, and again, that's our role sometimes, just to let them offload, and then sometimes just say, right, what feels like really important we deal with in the time we've got. So we are trying to manage and hold, and so yeah, so with parents, what do you want to see in yourself? How
Yeah.
do you want to actually be in the world? And if they've got low self-esteem, or they feel like rubbish, that we don't transform in the room gets transmitted outside. So they're going to pass it on. And so hopefully your client becomes more self-aware and self-reflective. And it's that impulsivity, isn't it? That brain we've got to learn how to calm the limbic system and the nervous system and the thinking. And so, in a sense, CBT is phenomenal for a lot of things, but talking therapy on its own is often not enough. There
Yeah.
comes a point where you're going to have to bring in the somatic stuff, body, because the two are so interconnected. You can't separate them out.
Yeah. As much as an ADHD might want to try and think, no, no body, no feelings, no, I need to do this thing. So I'm not gonna listen to that or pay attention to that. There's no time for that. And yeah, that it's so hard. Balance has always been the holy grail of, well, probably most people, but ADHDs in particular. And what is, like you say, and I heard you, because it's something that we do in coaching as well. It's helping the client get more specific around the definition of what the words that they use. Like so often, isn't it? Like the words that they use to describe themselves, or well, hang on, what do you mean by such and such? Or even when they're formulating a goal, it's so ambiguous that, well, how are you actually going to do that? Because what actually is that? So it's less likely they're going to achieve it because it's not specific enough or achievable at all anyway. So always about helping them kind of get clearer and, get more specific. It's a similar thing, I
Yeah.
guess.
And yeah, I mean, it's one of the key things for me, and I think probably for you too, is what language are you using? I did
Yeah.
that and it was rubbish, or I was just crap, or it was so disgusting. And it's like, whoa, let's just hold on a sec, because this is the language that's often been used on them. That critical voice, where did that start? Whose voice is that? Is that your voice, or is it someone from the past? So, and what meaning do we give things? So I think that's so important anyway in interpersonal relationships, is to understand what's the meaning you give that, what's your understanding, because that's when we get miscommunication, and it's all about communication.
Yeah.
And so who are you in relation to yourself, and who are you in relation to others? How does that change once you get the diagnoses?
Yeah, so it sounds like it's, again, about increasing that awareness, helping them be more aware of, what they're thinking, what they're saying to themselves in particular. And from what I've seen in coaching as well, um, what, and it's usually a very brutal narrative. Like ADHDers are so harsh on themselves. So, they set the bar so high for themselves and quite often don't even realize they don't, you've got most of the ADHDers, they can hear their thoughts. And usually those thoughts are quite damning. It's a bit of hell going on in there. They're beating themselves up all the time. But then, and I was training Wrexham University last week, and one of the DSA specialist mentors, I mentioned that there are also another camp of ADHDers, and I'm in this camp. I can't really hear my thoughts. I don't, so most ADHDers, right? They'll talk about this barrage of thoughts in their heads all the time, and they're all, they can't get rid of these thoughts. Whereas my type of ADHD or whatever else is going on now, I don't really hear my thoughts. There's nothing, I can't hear it. Which got positives and negatives there because it means I'm completely present. Like if I'm with someone, there's nothing competing for my attention at all. Like you are my.
Interesting.
Mm.
That's interesting because that's really interesting, actually. I never thought about it like that. Because when we say that people have these cognitive distortions, that the
Yeah.
thinking patterns, that can be difficult. But it's not just typical cognitive distortions aren't just thinking. You can have images as well. People can actually think with images and visions. It's not just about thinking words. So actually, it can sometimes be more about pictures and images can be difficult for them. Do you know
Right.
what I mean? So it's broader. It can be broader than that. But
Yeah.
yeah, I mean, it's really difficult one about
Yeah.
what we saying to ourselves, and
This is,
often that really critical voice. That's when we go back to childhood. I mean, babies aren't born saying that I'm stupid, I'm not good enough. They're really not. So where does that voice come from? That image, that feeling. But I think one of the things, I'm conscious of time, I think one of the things for us therapists, and I think the same for you, if I may say, is what I want to do when we've seen, we've understood, we've normalized, we've destigmatized what's been going on for them, we can actually make them realize that they can have hope. Things can be different. It doesn't have to be like this. And that, the world isn't ready for people who are neurodiverse still in a lot of senses. So how do we get you to understand that and then understand you? Again, about communication, relationships, what can be different now that you know what's going on? Not to have to mask, not to have to hide, to be and find your tribe.
yeah.
At the end of the day, to say to clients, find people who are similar to you, who understand you, not just friends, but also partners.
Yeah.
Things can be different now. Educate yourself, find your tribe, find someone who understands you. You know,
Yeah.
things can be different, and we
Yeah.
can give hope.
Yeah, that's the biggest thing, isn't it? From what I've seen as well. That, clients with ADHD coming, yeah, with like just hopeless. They feel hopeless. They've
And
got,
helpless and
yeah,
helpless.
yeah. And usually it's because, like you've said, that negative messaging. And also, I really believe and have seen, you teach others how to treat you. So, if they're beating themselves up, they're setting such a low standard. There's no expectations of any, like they've stopped wanting, they tell themselves they have no needs, so I don't expect anything from anyone, it should be me that should be doing, the people pleasing, doing more. And the thing is, unfortunately, yeah, you teach others how to treat you, but they don't realize that they're broadcasting that same, what they're saying to themselves, those standards they're setting are actually being broadcast in terms of, you know,
Yeah.
yeah, and they don't
This
realize.
is it.
Hmm.
It's interesting because it's not what happens is that if I think I'm no good or I'm crap or I'm stupid, what you do is you find people who reinforce that view because it makes you feel safe. So what you do is you find people who reinforce the view, and there's a lovely clip. Anyone who comes along and says, "Oh, I think you're wonderful," or "You're really creative," or all the things ADHD gives you, creative, curiosity, flexibility, all of those things, and someone gives you a compliment, it doesn't fit. So then you go like this. So you actually don't just educate people about yourself, you filter the people who fit your schema of yourself.
That's
It's a
thank you.
double whammy.
Yeah, thank you for articulating it like that. Because as far as I've, I'm not therapy background, haven't done psychology. As far as I went was, yeah, we definitely teach others how to treat us. But the way you just explained that,
You're right. You're right. We do because we give off how we're accepting of what they're doing. But what we also do is like, I get a client who says, I had a client who kept meeting these women who were just bullying and demanding, and it was all about them. And, we started to look at all these relationships and said, there's a pattern here of what you're doing here. And then we really explored his view of himself from childhood, which was that he couldn't ask for his needs to be met. He couldn't assert himself. So, of course, he was finding women. And again, the transference of these people reminded him of his mom or his sister. It was familiar. And one of the things people think is because it's familiar, it's safe. But it's not. It's familiar, but it's not necessarily safe. So, of course, he was filtering out all these lovely women
terrible.
who were being very different because it wasn't familiar and it wasn't what he thought he deserved. 2 years on, he's engaged the most wonderful woman who treats him wonderfully because he now realizes he was filtering out as well the people who didn't fit his schema of himself.
Yeah, it's
So
so
it's all interconnected.
yeah. So it sounds like, yeah, so there's that first kind of being aware that that is what you have been doing. I think that's so powerful, right? And that's what you work on. And I guess by going back into the past and being able to see, and unearth kind of some of those situations, what was happening at home and why that then continued, etc. But how, so yeah, because I know we've only got a few more minutes. There's been hopefully very helpful for everyone else as well. Um, so there's the awareness part then, but how do you shift that? If you're so used to, not having needs and, setting such a low standard, right? And, meeting everyone else's needs. In practice, how do you help shift that as a therapist?
Well, it's not easy
No.
because we're hardwired to do this and it's behavioral. You get a trigger, you get a stimulus, which is someone being horrible to you, and you get the response, and that becomes hardwired in the brain. So, for example, someone puts you down or shames you, so you go into that sort of withdrawal or child place. Yeah, you swallow your own needs. So it's about psychoeducation. It's about in the room modeling what it can be like to have a healthy relationship. And that's where we, as the therapist, help to model what it's like to have a healthy relationship, to challenge each other, to not agree, to have our needs put out there. So we model that and we look at your thinking, look at what you're feeling, look at the association of how you've behaved with your boss now and how you behaved with your dad 30 years ago.
Mm.
Where's the connection? About being able to take the mask off and allow ourselves. And it's really hard. It's brave work, therapy, because you're starting to strip away. This is who I've been. Same as with ADHD. This is who I've been all these years. Who am I now? I've got a diagnosis and I can actually have some coping strategies and interventions to make me different.
Mm.
What does that mean? So that's why we take it slowly, because people have built up this framework of who they are, whether it's healthy or not, but it gives them safety because they think they know.
That is hard. That's going to be, yeah.
So it's a slow process and it's a combination of EBT strategies, interventions. We blend.
Yeah. And I guess as well, that's how therapy and coaching are really helpful there in terms of if there is a certain thing that you are wanting that person to do, on a regular basis, that's something that the coach as well can kind of provide accountability around as well. Ask them how, that there are certain ways we can work together, I guess. Like, how would you say something like that? Would you want the coach to do? Like what's the kind of, yeah, way you'd work with a coach, HD coach for not just that issue, maybe there's other issues you find even would be more helpful that you'd want to work with an HD coach on. What types of things would you say?
Yeah, I think I mean, broadly, we're looking at the more deeper, I think, mental health issues and the comorbidity with other things, and through the lens of looking more deep into childhood experiences, attachment, attunement. So we can help the client to understand more about themselves and then to think about how they can be different in the world and what that would look like. What, you know, this is cognitive understanding, but it doesn't necessarily translate into behavioral change.
Yeah, and
You
that's
know, this is cognitive. We get stuck here sometimes. We call it cognition without ignition. We know it, but we're not doing anything with
yes.
it. So we have to try and get practice. And then the coach can be the person that helps support them with goals. Again, helping them to think about what would be helpful in the world, maybe more work orientated, but we can support in different ways that are complementary.
Definitely.
And I think one of the key things for me, just to end with, is that, and this is a lovely quote from Edith Eger, who's a wonderful therapist and psychologist. And she said, we get to be very good at what we do a lot of. So if you worry a lot, you're going to be very good at it. And if you panic a lot, and if you catastrophe, so it's about what am I very good at, and is this helping me? And how do I rewire, which we can do, the brain to send off different transmitters to make life different, changing the old groove pattern of how we think, and we start a new groove. And it's challenging and it's time consuming, but it can happen. It can be transformative, as can the meds,
Yeah, and all of it
as
together.
can the coach.
Yeah, all of it together. Honestly, it is. It is transformational. So, and what we'll do, I think we've had a few questions just in terms of recordings. When are we going to can we get the recording of this? So yeah, basically all of the interviews, all of these webinars in the summit, they will be made available on our YouTube. So that's for Empower ADHD and Ascend ADHD. So you'll get recordings, you'll be able to see all of those again. And we can always, also, if you're interested in therapy, yeah, I'm sure Ruth's probably full, like most therapists that are ADHD informed, but we can, certainly put, your details out as well, so people could contact you. But thank you so much, Ruth. And I have the pleasure of your daughter later tonight to talk about her experience of ADHD coaching at university, the dreaded dissertation. I still remember that, by the way. Like, this is like, I remember that journey. Like, it's
Well,
crazy.
I will never forget what you did for my daughter, Stephanie. You got her through. So, Stephanie, I can never say thank you enough for what you did.
It
That's
was,
all.
thank you. It was a pleasure. No, honestly, it was a pleasure. I love my my coaching of the university students, and Lauren, it was fantastic. It was fun. It's fun. It's a bit mental, obviously, 2 weeks, but we had a clear deadline.
Yeah, and that's what kept her on track. She said to me, I knew I had to speak to Stephanie every day, and that's what kept me on track.
And she showed up every day. She was great. She showed up, did the work, and is doing fantastically, which everyone will hear about after the break. So you must be, yeah, everyone get up, have a break. We've got 20 minutes, and we will see you back here where we'll be talking with Tamizi. She's the Senko of St. Albans Girls High School. And so we'll be talking about parent training and also our academic coaching and how some of their students have, yeah, been benefited from that. So thanks again. Thanks again, Ruth. And I think I'm seeing you
My
next week.
pleasure.
Yeah,
Yeah,
but have a great rest of the evening.
thank
And
you.
guys,
Well done. It's an amazing day, it looks like. So well done, all of you.
yeah, thanks for being here. So we'll see everyone in 20 minutes. Go get a coffee. Thanks.
Take
Bye.
care.
Hello, everyone. We're back. I hope you had a nice break, and hopefully we've got B still with us. Let's have a look. I might need to retrieve B. So 1 second. Hopefully she joins us. Here she is. Hello, B. How are you?
I'm good, thank you. I think I got stuck on the wrong webinar.
It's okay. Don't you love IT, love Zoom, but
Yeah.
thank you for being here. I saw that you were here right at the beginning.
Thank you for having me.
Yeah, how did you find David's talk?
Yeah, no, it was good. It was good. Yes. It's you can just get lost in listening to people like this talk, and you realize the hours have gone by, and you just scribble little notes to yourself to remember for later. Yeah, it's really good.
You can tell though, in terms of how it was described in the coaching process,
Mm,
like you could tell it is really quite, involved. This is something that he's obviously developed, over
yeah.
years. There's specific models. It's not something, you
Well,
know.
it's 25 years.
Mm,
That's
yeah.
like the longest research ever.
No, well, he's developed these really good models. Like they teach us some fantastic models again that it's funny because at the time when I was, yeah, sorry about that. Are we recording, hopefully? Yes, we are. We're good. Let me just come back.
Hmm.
Now I'm having interesting, here we go. Let me just see. I've got to record this.
Okay.
I think I stopped recording. So we want to record to the cloud. Just recording it back onto the cloud. My computer decided that it had had enough. There was way too much on there. But let's get started. So,
Okay.
Bea, would you like to let everyone know who you are? And yeah, we can get into it.
So, so my name is B. I work as a Senko at independent school, and um, and I've been working as a Senko there for a couple of years. Previous to that, I work as a Senko in the mainstream schools, and I've been, working as a teacher alongside that for about 20 years as well. So quite a lot of experience in secondary schools teaching students from age 11 to 18. Yeah, but currently I work as a Senko at St. Albans High School for Girls.
Yeah. And yeah, no doubt it's not the easiest position teaching, particularly
Mm,
being a Senko.
yeah,
Given, I guess, COVID, you would have obviously seen the impact of that as well.
gone through that as well, yes, which was quite unprecedented. It's completely unrealistic scenario. Nothing, you can't compare it to anything that we've ever experienced, and we still see aftermath and ripple kind of waves from that, and we will be seeing that for quite few years to come.
Yeah, no, I mean, no one could have anticipated that. And like we were talking about, like you just
Mm.
said, as adults, we don't know what that
No.
could be possibly like, having to navigate education in that way.
Mm.
So yeah, it's not surprising that so many are struggling. And then,
No, and we both, you and me, we've seen it from a school's perspective, but also we've seen it from a perspective of a parent at home as well. So,
they had the pleasure of being, the teacher, the one on the ground, the one that needed to direct the attention back to the work.
no, yes, yeah, imagine, yours were a little younger than mine. Mine were proper teenagers at that point. So,
Oh,
so
funny.
yeah, so that, yeah, we've had ups and downs, and well, my oldest was diagnosed with ADHD, and he struggled quite a bit through the COVID. Yeah.
And consequently, as well, parents, right, trying to support. Again, it's so difficult. And when you've got the multiple children at home, if there is ADHD,
Yeah,
there will be conflict.
there
There's got to
will
be
be,
that
yeah.
to sort
Yeah.
out as well.
It's just one of those situations you have got to live it to believe it.
Yes, yes. Hopefully, well, I'm sure any parents here, I'm
Mm.
sure they're living it right now. And that's why it's good they're here though to understand how things like education to parents, parent training, and how helpful that can be. So obviously, so the way B and I think we did the parent training to some of the parents of students of your school second year, wasn't
Yeah,
it? The second year this time.
second year running now, yes.
Yeah. And how did parents receive that training? Have you seen any like what would you have what have parents said kind of was maybe most impactful or beneficial about the training?
So, we've noticed after the first session we've had now a couple of years ago, I think, that it landed really well with our parents, and they really appreciated. They kind of accepted that as a platform for them to be able to express how they feel about how things are going at home. They felt
Oh, hang on. Got a little bit of a frozen. I think B has frozen. Maybe if B, you could come back. Maybe try.
and after the first session,
Go back. Hang on. B has gone, but she will hopefully come back. The perils of these kind of online webinars. But here we go. B's back again. We persevere.
hello,
Hello.
hello, hello. I'm back.
Oh,
What
good.
happened?
Hello again. I
Hello
think
again. So sorry, I don't know what happened, but anyways, yeah. So really loved it, and we immediately after the first session we received comments from parents saying how lovely it was to be part of that seminar, and when is the next one straight away, and very similar feedback from the most recent one. Also, parents absolutely loved it, and it does value them as members of the community, of the school community. They feel that they belong to the school, not just the children. They feel that their opinions, their points, their views are valued and shared and taken on board as well, which is really good because that's what we wanted to achieve. We wanted to bring the parents closer and make sure that they are also educated and trained and they know how to support their daughters at home and also it provided that consistency of approach between the school and the home, so we kind of have the same, we sing in the same hymn
yeah,
literally.
yeah, because
Mm.
that's always the struggle, isn't it? Because obviously the same, it's got to be the same message. What the
Yeah,
school is saying, as well as kind of what the parents are doing at home, that
yeah.
consistency for the children. I remember the first training session. Some of the things that we talked about and presented, it was quite hard for parents to accept at first, to be able to
Mhm.
accept that no, that this is the experience the children are having, and they're the children. You guys are the adults, and as hard as it is, particularly if you do happen to have ADHD yourself as a parent, but we need to be able to hold the space, and that's what I think what Ruth was saying earlier in terms of as the parent, right? The
Mhm.
model we model for them.
Yeah.
Um, yeah, so and as if you've got ADHD as a parent, it's going to be really hard to hold the space. It's going to be you're going to struggle to regulate yourself emotionally as well.
Hmm.
Struggle to not be overwhelmed because you've got executive function difficulties
Yeah,
on top of that. However,
exactly.
we know what happens when,
Hmm.
hold the space. And I think that's what got parents over the line because they couldn't, you can't deny that when you
Hmm.
escalate during these kind of tense situations, it never gets better.
No, but what they valued as well, it was the fact that both sessions were quite practical in content as well. So they liked that they could take something away and they could implement it straight away at home. So they appreciated that aspect as well. It wasn't just someone teaching them about ADHD. It was practical, it was lived, and it resonated with them. And that's what really uh, 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 made the session really successful. And I'm sure there'll be plenty of more to come because they really like that.
No, and hopefully as well, it meant, because obviously as teachers, as Senkos, when
Mm.
trying to support a student, it can be obviously difficult if you
Mhm.
feel like you're on the different page to the parent. So has that helped as well like I think you were talking about how it sounds like the conversations are more, they're happening now, perhaps. Parents are a bit more comfortable to talk
Yeah,
openly about their challenges.
yeah.
What have you noticed?
Well, it definitely opens the minds and accept the fact that the ADHD does not necessarily always needs to be a barrier to learning, and the parents more well, okay, we've got a daughter with ADHD, uh, but that doesn't it's not. The parents just wants to they wants the teachers to see beyond the diagnosis. They want them to see the strengths, the creative ideas, the problem solving. It's all they want to see the strengths first. And the parents really appreciate when the teachers provide really honest feedback. But feedback that also kind of focuses on strengths
Yeah, the strengths, and that's what we.
rather than just always where, this is where they fall, you know, short of this grade and you have to do just concentrate on, the strengths of the daughters. Just look beyond the diagnosis and see the actual person.
Yeah, so I'm really glad that that happened too, removing that stigma and
Mm.
that strengths-based approach.
Yeah.
It's so important for both parents and schools,
Mm.
obviously,
Oh,
to be able to appreciate.
hello.
Can you hear me? Oh, can you hear me, B? I think we're frozen. It's okay. We'll come back again. Bear with us, guys. But yeah, the strengths, I'll just talk a little bit while B hopefully comes back or starts moving again. But that is why the strengths-based approach is so important. And what David Giwerc was saying with ADCA, the certified ADHD coaching, what really differentiates it from life coaching is the signature strengths kind of focus. It's very much kind of making that strengths-based approach really tangible, actually. It's a way that ADHDers can access that strengths-based approach and giving them the actual name of the strengths that apply to them.
Mm.
So yeah, the strengths-based approach is absolutely transformational. So I wanted to ask you though, specifically for you, I think it'd be helpful for parents to understand kind of, what challenges do teachers come up against, like when supporting students with ADHD. So the teachers that come to you for
Yeah.
assistance, what are those kind of issues that they're facing?
Well, so, coming from both angles, the Senko and the teacher, I think the teachers the biggest challenge for the teacher is managing or balancing the needs of the students with ADHD together with having a class full of other students as well. And sometimes they will have 4 or 5 students with ADHD in a class, and the time is limited.
Mm.
So balancing that is it's always been a challenge, and understanding beyond the behavior for teachers as well. So it's not about the lack of effort, it's not about lack of motivation. Understanding that this is more about how the brain processes environment and the information provided. So therefore, we heavily invest in teacher training, and we've moved a really long way from what the ADHD was perceived when I started to what it is perceived now. And teachers come up to me and very often say that they appreciate the training given because there is a lot of things they do already they didn't realize they were doing, but the strategies that they're providing in class is already in line with what we would like to see. The practical challenges, such as the time and the resources, is always going to be the biggest one for the teachers. But once the teachers understand the ADHD and are confident, then the things are really going very smoothly, and the students feel that the teachers understand them better. So, yeah, so the training is a key here for the students and for the parents. But once we have this established, it is really rewarding to see how the students themselves grow in confidence and don't see ADHD as a barrier anymore.
Good. Because, I mean, again, I think I was saying to you, B, that with coaching, so many of the people I coach are, at the top of the industry.
Mm,
A lot of the high performers, a lot of lawyers, doctors,
mm,
financial institute bankers, traders are all ADHD because, it's that level of stimulation, that challenge, the urgency.
mm.
You've always got some kind of, stimulation there to keep the brain whirring.
Yeah.
And so, a lot of ADHDs are high performers. But I guess equally that can be a problem in terms of burnout. So,
Yeah.
of your ADHD students,
Yeah.
do you have would you say that, because I guess your school is more, I think is it selective performance?
Yes, so we do have 11 plus exams uh, um, to get to our school, and yeah, well, it is an academic school, and the pressure can be quite high, and so the students that join stacks would be the students who have to pass 11 plus, so they're already academically able. Um, and then obviously they have performance reports throughout the school years, and obviously it can be quite pressure high environment, and as we know, ADHD people who with ADHD don't necessarily not necessarily take the pressure well, but they are very prone to burnouts, and also the mindset of wanting to be the same as everybody else, and perfectionism,
Mm,
and and not wanting to look like anyone else, it is all kind of piles up to a boiling point at some point. And this is what we're trying to avoid when we meet with the students and we talk with them, and we sit down and we come up with the strategies, and they're very much in a driver's seat when it comes to what they want to see happening in the classroom for them. And yeah, so burnout is something that we very much aware of. Yeah.
yeah. And we worked with one of your students
Mm,
with the academic success program we did.
mm,
Think a year ago or so now. And
mm.
yes, that was one of the type of students that was more
Yeah.
burnout, very high standards,
Yes.
kind of a lot of, really feeling they have to push. And in terms of that program, I think we talked to you about kind of the elements and what we saw with this student, the benefits, and it'd be great to hear, from your experience, what you saw on your side when she was doing the program. But certainly what we saw, um, her kind of relief at being with other students that had similar kind of sensory sensitivities in particular to her, because a lot of ADHD is what's not maybe as widely known is many ADHDs have sensory sensitivities, so sensitivities to noise, smell, taste. And, some of these reactions can be really visceral. Like, so even listening to someone chewing food, like I've had some clients, for instance, say that, they just want to rip their skin off when they hear someone chewing, you know? Oh no, we've lost B again. She'll come back, but hopefully B will come back. But yeah, sensory sensitivities is something that it's not widely known that ADHDs have, but what we found was in this program, because students are doing this together, um, they're sharing obviously their experiences. And for the first time, this particular student, she was able to hear from other ADHDers that shared her sensitivities. So you can imagine what that would have done in terms of the guilt and shame that she would have been feeling around, around those sensitivities, not realizing, that, oh, hang on, this is an ADHD thing. It's not just me, because you can imagine you'd feel pretty bad if you're having these reactions to people. People are just being people doing normal things, right?
Yeah.
Like you shouldn't be reacting like that. What kind of person am I that what's wrong with me? And that
Yeah.
so tears, the most, beautiful, caring, really kind
Mm.
ADHD is actually probably the most the ones with the most empathy, the ones that really, really are very kind and would do anything for you, to kind of have that reaction, very confusing.
Yeah, no, definitely. And yet again, we wish more of our students would be a part of your program because we see the real benefits of it. But yeah, all this is the students' decision at the end of the day and the parents' decision. So,
Mm.
but yeah, definitely, I think there would be most students that would benefit from that. We see this, we've got new cohorts of students every year, and the prevalence of ADHD is just growing in numbers, and there is really no escaping this. It is coming,
You sound
and
like
we.
you sound the second coming. It's like, I love,
It,
yeah.
don't forget, this is independent sector,
I
so.
know you're a teacher, you're a saint. I mean, I couldn't do what you guys do. You know, it's
Mm.
for me to talk about ADHD. I mean,
Yeah,
I'm a parent, so I have seen, you know, I've seen the dark side of ADHD. Um,
yeah,
genuinely.
yeah,
But it's tough, definitely, you know. I mean, so many teachers, the turnover,
yeah.
the mental, like when we did the Westminster Insight Conference was
Hmm.
education, and so a lot of teachers were sharing their
Mm.
experiences, and honestly, yeah, the mental health was, you know, was the key issue. It was about, you know, it's not just, you know, understanding neurodiversity and how that affects mental health. It's the teachers supporting them and the need for them to support each other, to check in,
Yeah,
like to be
yeah,
curious. Like that was that was a really strong theme at this conference, was the poor teachers, right? Because you can't
it,
pour from an empty
it
cup.
is not easy. It is not easy. The teachers are under the pressure from every corner. And like I said, the time is probably the biggest issue for the teachers. How they would love to be flexible in the lessons, but I have got the clock ticking at the backs. But I have to say, we're moving away from the old type of differentiation and more to adaptive teaching in my school. So it's all of those small changes and tweaks and movement breaks that not necessarily have to always be outside of the lesson, but understanding that the movement break could be two students getting your students to stand up and talk to each other. That could be a movement break. So consistent training impacts on teachers' understanding, and the more understanding the teachers have, the more confident they are of delivering the strategies.
Yeah,
Mm.
definitely. And it sounds like you're doing a great job there. Particularly what I heard was that, yeah, you ask the students. It's about
Mm.
taking that coaching approach. No two ADHD is the same, and kind of
Yeah,
with that curiosity. Um,
yeah,
what do you need? Because the more they understand their own ways of
mm,
working and learning,
yeah,
and this is what the program was so good for. And so yeah,
mm,
definitely, it helps you guys as well. The more kind of if the students can get support from from us to
mm,
understand their ADHD,
mm,
how best they learn, and be able to communicate what they need, right?
mm.
And that's going to make
100%.
it easier for you at school.
100%. And also the fact that we can always communicate with the coach, and the coach can provide us with a strategy or insight, or have you tried this? It's so valuable because sometimes we're at the wit's end, to be honest.
No, you need support.
Um,
Yeah.
yeah, and it's great to have always somebody who knows what they're talking about and have experience in working with young people, and having them telling us that we are doing everything we should be doing is also very powerful for the teachers to hear. Because sometimes they question their own ability of doing things, saying, "Well, I've tried everything. I don't know what I'm doing wrong." And to say that then to them is, "You're not doing anything wrong. You're doing absolutely everything where you're supposed to be doing it." It's also really, really good for teachers to hear that.
Yeah, and that's the strength of the training. It's about being able to look through that lens and adjust expectations accordingly, exactly what you've just
Yeah.
said. That is,
Mm.
it's key. So no, well, we absolutely love, we feel privileged to partner with your school. Yeah,
Mm.
this is what we're doing. It's an ongoing partnership. It's not just we drop in, train you, and leave. We're here,
No,
yeah,
no.
because that's what's needed.
Yeah,
Yeah, that's what's going
because a lot of times, a lot of other trainings is what you just said. They will come in, they will deliver the session, they will leave. Whereas here, I feel it's more like you said, partnership. You know,
to start with.
you just always at the end of the email or phone line, please help. I'm not sure what am I supposed to be doing here, it's just great. It's really great.
Yeah, no, it's great for us too. It's a pleasure, honestly. So thank you, because again, I know you must be so tired from your day at school, and the fact that you've taken this time out to speak with us. Thank you so much, B. Honestly, shows your
My
dedication.
pleasure.
Yeah.
Thank you.
Anyway, off you go. Go have some dinner.
Yeah, very much so. Thank you. Take care. Bye bye.
Hi. So that was B. So very lucky to hear straight from B, and she's doing a remarkable job. Honestly, we are always so delighted when we have Senkos like B come out to us, proactively looking for support. Absolutely, so heartened when that happens. So yeah, it's going really well. So the next thing we're going to do. So now I'm going to show a video. Basically, we are now partnering with Wrexham University. Really excited. Wrexham University, they came out to us. They'd heard about these academic coaching programs that we'd been doing, and got in touch with us. And last week, me and Eleni, another coach, we went to Wrexham, to Wales last week, and we trained all their DSA mentors and specialist study skills tutors. It was fantastic. Really, like the wealth of information that they had as well was just really fantastic conversations and swapping information. So we're really excited to be partnering with them, and we're currently finishing off a course, an online course that we've created for students with ADHD. So they're going to be rolling that out next month. So that's going to be very interesting, and that's going to be a course that their DSA team are going to be able to draw upon when supporting their students. So they are very much the pioneers in this space in terms of universities, definitely in the UK, and hopefully this will be successful and it will then be rolled out to the rest of Wales, we are hoping. So watch this space. So at the end of this training, we did a little interview with them. So I'm going to attempt to try and share my screen. Hello and welcome to the HD Coaching Summit 2025, day one. And we're talking about family and education. And we've actually just finished training Wrexham University's DSA specialist mentors and study skills tutors. And I've got here with me Sarah Roberts and Ellen from Wrexham, and I'll let them introduce themselves first, and then got a few questions just so that you guys can understand the benefits of ADHD coaching and training in higher education. So, Sarah, would you like to introduce yourself?
Thank you, Stephanie. Hi, I'm Sarah Roberts, and I'm Head of Inclusion Services and Disability Support here at the university. And I'm Ellen Coleman, and I'm one of the specialist mental health mentors within the inclusion team.
Yes, and they are absolutely amazing, honestly, truly, and pioneers in this space. My colleague Eleni and I, we've known that there's been a need for higher education awareness in terms of the ADHD, developed some programs, and we tried to get it moving with other universities, but didn't really get traction. And then, so we parked it. And then out of the blue, I get this call from Wrexham, and be interesting actually to ask as well, what made you reach out? Because yeah, it took us by surprise, because I just felt at the time, probably about 2 years before you reached out, we were trying to put it on the agenda of universities, but obviously either weren't ready. But you guys were the first to actually engage. And we recently did this podcast with You're Wrong About ADHD, and rightfully the presenters shouted out Wrexham for its foresight and it being a pioneer in this space. What made you come out for this specialist support?
I think in terms of the support we provide here for students, we have all our in-house support. So we have, like you've mentioned before, our DSA specialist study skills tutors, our DSA specialist mentors to support students. And although the team are doing a wonderful job in terms of supporting students, we're finding lots of students coming to us who are maybe newly diagnosed with ADHD or seeking a diagnosis. So we just wanted to make sure that we're giving our students the best possible support that we can. So it's about seeking out with yourselves, Stephanie, to enable our staff to be fully equipped to support students with ADHD, as well as looking at something that we can provide to students, such as our Thriving at University module, in terms of something that they can actually utilise themselves to recognise their potential in their studies.
That's fantastic. And you did some digging around, didn't you? I remember because you came across the videos that were done.
Yeah, there was a few resources that we'd seen in different places, and I think it was clear that you were doing a lot of work in this area. So when we was reaching out, yeah, your lovely selves really stuck out for us.
I'm glad. That's what we found. There was this gap and a massive need coaching students at university, and the horror stories that some of them told us, going through it with them as coaches, particularly during dissertation times. We coach people in the workplace, and the burnout that we saw, that we see when coaching university students, in some ways pales in comparison to the workplace, to some of the employers with burnout, because there's so many reasons why, right? Which is what we're talking about today with the transition from school to university, but also just the sheer amount of work, the essays one after the other. And it's really difficult, isn't it, for people with ADHD? In terms of this support, you are obviously one of the first universities to provide this kind of support to students, to train up your in-house DSA team. What are you hoping for? What are you hoping to see at the university as a result?
I think often, and you can see it within the way that DSA is organised and a lot of the conversations around neurodiversity and neurodivergent people, I think sometimes ADHD as a diagnosis or the experiences a lot of people with ADHD have gets taken in with a conversation of many other things. And sometimes that unique experience of ADHD students or students with ADHD gets lost in those conversations. So I think we wanted to make sure that we're really targeting the needs of the students that are coming through our service or who might not be through our service yet because they don't have that formal diagnosis because of those waiting lists, making sure those needs and those unique experiences aren't being overlooked just because there isn't a particular support route through the DSA model or traditional university services may not be organised in a way that has that at the forefront. Yes.
Yeah, again, proactive of you to realize and do something about that gap. Like I was saying before, in terms of the DSA support around ADHD, we had that conversation with the DV a few years back, and they acknowledged that there wasn't that informed ADHD support or pool of support that they could offer students with ADHD. And they actually said that it wouldn't be fair to provide that specialist support because there wasn't enough supply. You'd have some ADHDs getting the specialist ADHD support, and then all these other ADHD university students getting maybe that autism lens, given that they have put ADHD in the category for the non-medical helps, ADHD falls under autism. Yeah. So that's what we were told. And obviously talking to everyone today, the breadth of knowledge around all the neurodiverse conditions, it is very much there, thankfully. But still, these conditions, even though ADHD falls under the neurodiverse umbrella, it is distinct. And for instance, and we talked about this today as well, ADHD medication, right? Like you have to have that ADHD diagnosis specifically to be able to benefit from the ADHD medication, which can be transformational. There is a danger, isn't there, of not wanting to label. And that was interesting to see people's different views around that and be able to explain why put a name to it is so important.
And I think sometimes it's not even about whether somebody is or isn't taking medication, but just knowing there's options, because even if somebody is taking medication, building up that skill set is still so valuable, and building up that confidence in their own ability to engage in university the same way any other student does, or access and achieve the things that they set out to do, is really important, whether they're taking medication, whether they're not. And I think sometimes we're all doing wonderful work across many different universities and within our kind of different specialties. And sometimes that's based on previous experience working with people. So we see things that work and tools that we can support students to develop. And I think access and training like this just puts some things in a clearer way for us. We know some things work. This is why it works, and taking it right back to the ADHD lens and giving it a bit of a clearer picture as to what we're doing well and what we could do to add to that service.
I think for us at Wrexham, recognising the great potential within our students, it's really, we do try and provide that personalised support, recognising the needs of our individual students and seeing how we can put strategies and support in place to really help them thrive.
And from the sounds of it, there is a huge amount of knowledge and very much drawing upon strategies that have worked, and hoping that the coaching approach we talked about has been helpful for the study skills tutors and specialist mentors who did say to us that they are doing parts of that within what they're doing, which was really encouraging, because it is such a transformational way of being able to get the best out of ADHD, taking that strengths-based approach, that non-judgmental space. From what we heard today, and it's no wonder why you are at the forefront. And that shout out from Katie and Sam from You're Wrong About ADHD, very well deserved. And we're really excited to be partnering with you on this journey. So I think the next step's obviously that Thriving at University online course, getting that rolled out to the students and working with your DSA team to help them understand the components and what will be helpful as and when these things come up in their sessions with students, which is just fantastic for them to have that resource. We look forward to getting that finalized.
You know, from that online platform for the students to have, it's something they can do in their own time or work with the specialist tutors or mentors, but it's about building that confidence, that self-advocacy, that strengths-based approach, anticipate what their needs might be, for example, and also maybe looking at where challenges are for those students and where we can help support them.
Yeah, we talk about naming it to tame it and coaching all the time, and that's exactly hopefully what the course will help enable, to name those things so there's more targeted strategies and supports.
Yeah, I think it'd be really useful for some of the students that I work with, in the sense that they can, before they come to me, they know they might be struggling, but knowing what they're struggling with can be really difficult sometimes, and communicating that with another person can be even harder. So having something that they can go and that will direct their self-reflection I think will be a really useful tool. So I think it's something that even if students are accessing mentoring, it's something that can be used before or during sessions, not just something that's there as a tool to replace that mentoring.
And it could be even, we're going to roll it out for all students. So even if they've not accessed our support services yet, it's something, it's a tool they can look at. They may encourage them to seek support because they can identify where they can obviously look at their strengths approach, but maybe look at where things are more challenging, and then they may reach out for us to help them along the way.
Yeah,
that's a really good point, actually, because a lot of people with ADHD don't understand it, and so by accessing that course, being able to see more of the picture, and if they do resonate, they're more likely to be able to reach out for support so they can help themselves and engage with the support that you provide through your team.
And that post-diagnosis stage, a lot of people, I think, have the misconception that once you have that diagnosis, so much falls into place and things make sense and things get easier. And I don't think that's always the case. And I think for a lot of our students, if they're already at university, there's so much, it feels like there's a lot of consequence to getting this right. So if there's anything that we can offer students during that diagnosis process, whether it's before, just after, or while they're finding more out about themselves while they're here, I think that's really a really useful tool.
Absolutely. It's absolute pleasure and a privilege to be working with you and at Wrexham. I just truly feel that they do really set the standard, and I'm very excited to be rolling out this program, and hopefully we get that engagement and get those outcomes for your students so that more universities can follow your amazing example. Honestly, students at Wrexham are very lucky, I can tell you now. They really are. Like, as coaches, we listen out, ears attuned, we get a good idea of what's said, what's not said as well. And from everything we heard today, the depth of knowledge, the willingness to learn more, honestly, your team and how they work together and how they're really keen to share and to receive more information so they can better support is really impressive. Anyone here, any student here, very lucky. So thank you so much, honestly, for your time. And we look forward to continuing to work with you, and let's see what amazing outcomes we can achieve for our ADHD students.
Thanks for coming.
Very much.
Thank you.
Hello, everybody. We are here with Rachel and Kate Jones, and we're here today just to talk about birth family history, a little bit about ADHD, and the journey they've had with that, and also the journey they've both had with coaching. So, first of all, how are you both today?
Super excited.
How are you doing today, Kate?
I'm well, thanks, Tim. And you?
Really well, thank you. Really well. Really well. Yeah, yeah. So, first of all, let's have a quick question just to introduce both yourselves. Could you tell us a little bit about your background?
So my name's Kate. I come from Jersey. I'm a pharmacist of 35 years. I studied in Cardiff. And together with my husband, we have one beautiful daughter who's called Rachel. And she is a truly beautiful person, both inside and out. And we're very, very proud of her.
Oh, that's wonderful.
So I'm Rachel. So I trained in acting, and then I kind of worked for a little bit. It's always been a passion of mine. It's something maybe in the future, but I've kind of been doing a bunch of stuff. And then through the magic of life, I found Stephanie, and began my coaching journey. And then this year I started working with Empower, and it's genuinely been incredible and absolutely changed my life. So super excited to be here.
All right, it's been absolutely brilliant to have you too. So if we go back a little bit, just to bring this sort of ADHD in there, Kate, was there a time when you first suspected Rachel might have ADHD?
Not at all.
Oh, right, okay.
Not on that page at all. I think she recalls telling me that she thought she was ADHD and I dismissed it. I don't even remember that conversation. But
Okay.
no, it was totally led by Rachel.
Right. So, Rachel, what made you think you might have ADHD? What was your discovery there?
So for me, it was as soon as I heard more information about it, I always kind of never thought anything was, but there were a lot of things that I was incredibly frustrated with myself about. There were a lot of things that I was like, why can't I just do this? Why am I so tired all the time? I can't keep anything tidy. I feel like this. And I just thought that I was just a bad person, which is awful, but it was that kind of frustration. I never considered ADHD because obviously, well, when I was growing up, it was one kind of definition. It was very much you're hyper all the time. It's young boys and they are running around and doing all of this. I had no idea in the way that it affected women. And as soon as I started seeing more information, it explained so much of a lot of the things that I was struggling with. And so I started kind of looking more into it. And then I was like, actually, yeah, this does sound a lot like me. And then we went for the test and it was kind of like, yeah. And it was just so many things that I hadn't even considered. I masked a lot kind of in public, in school, with friends. And so it was very much, I never presented like that. I was like, those racing thoughts and everything kind of speaking a million miles an hour and speaking every thought was very much in my head, but I was very kind of, and it was exhausting. And so for years I was shattered and trying to do the things that I wanted to do, like tidying, I've talked about before, was a big thing for me. I wanted everything tidy. It wasn't that I didn't want to do it. I couldn't do it. And I didn't know what that block was. So hearing about other people feeling the same way and realizing that it was ADHD, it changed a lot for me. And then going for that diagnosis, it kind of gave a lot of clarity to that.
And I think a lot of people will relate to that not fitting a stereotype image, in that not everyone's hyperactive, not everyone's going to be, just running outside the door, not everyone's going to be fitting that cliche of jumping up and down in the classroom. I think a lot of people, especially girls, may appear to be the most well-behaved person in the room, but that doesn't necessarily mean they don't have ADHD, but are different presentations, and those often go overlooked. Those are the ones that go overlooked, which is a great shame.
It's a contradiction of, you can't be ADHD because you're like this, but the ADHD is the masking, the internal, everything going on. And you're burning yourself out from trying to present this facade that everyone goes, so there's nothing wrong with you. But you're like, it feels like, but they're like, but you can't. And it's so hearing more about it. And I think it's why, having these conversations and doing
Yeah.
what we've been doing for Awareness Month is so important, because it took a big toll on me, and it was a lot of horrible self-narrative. It was a lot of exhaustion and burnout that I didn't realize was because I was trying so hard to do something that wasn't me, and I didn't know how to deal with it.
What was your feelings after Rachel got the diagnosis?
I guess relief. We had no idea how much she'd been struggling at school. On the face of it, she was getting great results. She was getting her work in. The teachers always reported how organized she was for lessons, which totally contrasted with how she was at home. Bedroom was a mess and so on, typical of ADHD, as we now know. So yeah, relief for her, because these cycles of burnout were becoming a big problem for her. And yeah, we were really worried about her and where she was going to end up.
And it was a relief for you to have that diagnosis, that kind of reassurance in terms of there was something which could be worked or something that you could understand.
Yes, it was. It was. And, we did ask her beforehand if she wanted that diagnosis.
Yeah.
Because, the question is, do you want that label? Is it a label? But actually, she did, definitely for herself, also for us, and then for friends, employers, colleagues.
Yeah.
I think it's so important to be open if you possibly can and tell people what's going on. And then that leads on to you being able to tell them what you need, and to be able to look after yourself and ask for the leave you need, the time off you need, the adaptations you might need that are going to mean you're not going to be in that constant cycle of burnout.
Absolutely. Absolutely. And can I just to clarify, what age was Rachel what age were you when you got diagnosed? When was that?
It was 2023, I think.
So it's quite recent. It's only 2 years.
Yeah.
Right. Okay.
Yeah. So was it 19 maybe?
November 23.
Oh, right. So it is quite, I wasn't, right. Okay. Okay. And another quick question for you, Kate. As a pharmacist, did you have it? What was your kind of impression of ADHD? How much experience have you had there with it prior to Rachel's diagnosis?
Virtually nothing. It didn't exist in my degree course, which was many years ago now. I actually looked back, and it started really in September 22, when I first started seeing a few private prescriptions coming into my pharmacy, people who'd had private diagnoses and were desperately looking for the meds. I knew nothing about them. I had to start looking them up. And then, of course, the shortages started to hit, the medicine shortages.
Yeah.
And people were desperate to get hold of them just to be able to continue with their lives. There were adults who had jobs to hold down, families to support. There were students who were just coming up to GCSEs or A levels, and all of a sudden they couldn't get hold of the meds that they needed to be able to function and carry on. So that's when I took it on as a bit of a mission. I was constantly onto my wholesalers, trying to buy stock when it was available. The staff were moaning at me at how much I was buying. I had to buy a new additional controlled drug cabinet.
Yeah.
But actually, it was so wonderful seeing how I could help these people. And then I needed to research what it was all about myself, for myself. So actually, the best source I found was Instagram. I'm not a social media person, but there are so many great sites on Instagram. And for a busy parent, they gave little bite-sized chunks of information that I could dip in and out of. And I actually learned a lot, and I still do from Instagram. So really, that's where my knowledge has come from, along with researching the drugs, which of course is my professional duty to know and learn about.
Absolutely. And do you think that's helped with your relationship with Rachel in terms of the understanding of the ADHD? Has your relationship changed because of that understanding?
I think it has. I remember one little light bulb moment on holiday when you talked about a difficulty, and I said, oh, yes, of course, that's because you feel like this, and then that happens and that happens. And it was about going out to the shop to buy something, and the whole process you would go through if you needed to go and buy something such that you didn't do it. And you sort of looked at me, Rachel, didn't you? And oh, actually, you get it.
It meant so much that you invested so much in it, and by you kind of having the knowledge and understanding it, it it helped a lot for me, because it was very hard for me to explain a lot of the things that I was feeling. And it was what obviously doing research and having coaching helped me be able to do, was explain those things that just seemed so ridiculous, when I'm like, I want to tidy stuff, but I can't. And trying to explain that to someone who doesn't have ADHD, who's neurotypical, it's like, well, then just, just get up and do it, because that's where the frustration came. And it's where kind of arguments would happen when I was younger, because I couldn't explain that it wasn't as simple as just doing that. And you didn't know why, I didn't know why. And so it was frustration and tension and disconnect. It was like, you're getting on to me about all of this, but I can't do it, but I don't know how to explain to you why I can't do it. And you don't know why I can't do it, because it doesn't seem to make sense. Having that understanding is so important. And so I'm endlessly grateful to my mum for putting in the time and dedicating, a lot of time towards understanding it, because it's helped us massively. We can communicate so much better. I can say, I might not be able to do this, and you understand. It's not well, why? It's simple. Just, picking up the phone and talking was a big thing for us. And being able to like explain, I'm in the middle of a hyper focus. If I speak, it's gonna do this, rather than it just being but just take 5 minutes. It's like, now you understand what it means, and it's helped tremendously. And I think we are closer than we ever have been, which is so lovely, because we never had a bad relationship. There was just some things that we couldn't understand with each other, and having that understanding now has brought us so much closer. So it's been such a big journey, and genuinely life-changing for me especially.
Yeah, I'd agree with that. And communication. There's a great video on one of the Instagram pages that I follow with Love ADHD, Rich and Rox, and they do a great one about communicating how she feels and explaining why and explaining what she needs. And that just helps take everything down a level when you understand what the other person is feeling, and they offer a solution. Okay, well, let me do this, and then we'll be able to do that. And that's great. So communication, that's the real biggie for me.
A lot of it as well came for me from the understanding of myself through coaching, helped me actually communicate those needs even better and even more specific. It wasn't a just kind of general ADHD. It was, oh no, this is me. This is how my ADHD and my signature strengths mean that I feel like this.
Brilliant. That is wonderful. That is wonderful. Just going to move on just to towards the coaching and just towards that journey as well, as you say, Rachel. So before you started the coaching, before you started with Empower ADHD, what was your immediate journey before that? Whereabouts were you based?
And so for about a year and a half, basically just before I started, I was doing door-to-door sales, which I really enjoyed, because I did really enjoy, the interaction. I liked the kind of the understanding of it, and meeting people and hearing everyone's stories, meeting everyone from every different background, having those conversations, building relationships. The trouble was, it wasn't sustainable for me, because obviously with ADHD, I'm using a lot more energy than people would normally. So every interaction is costing me way more energy than somebody else would feel. Plus, the hours that I was working were long, 6 days a week. It was a lot of walking, obviously, a lot of exercise. So I kind of managed to push through quite well for maybe about a year, 9 months, a year, I was in it, but then everything kind of caught up, and I was just in burnout after burnout. I would be working for 2 weeks, absolutely fine, And then I would just, my body was physically telling me to stop. I would get ill, and not ill to the point where I was kind of a little bit cough and sniffly. Like I could not move a muscle. And it was kind of a cycle of this. It was every 2 weeks something would happen, and it wouldn't just be a day that I needed lots of days. And I didn't really understand why that was happening. I knew that I had ADHD, but I didn't understand how it was, why it was affecting me so much. And I didn't understand that all of the masking, all of this was just leading up to this. And every kind of conversation, if there was something that wasn't good, it was having an effect on me because of my ADHD, because of RSD, but also my signature strengths. And it got to the point where I went to the doctor, and he was like, you have to stop.
Wow.
He was like, you took my blood oxygen and everything. And he was like, they were so close to sending me straight to hospital.
Wow.
Because it was chest infection and a lot of things going on with my heart rate and stuff, which was caused. I was medically burnt out, and they were like, stop. I was thinking I would just go down to get some antibiotics for my chest infection that I suspected, but they were like, no, enough. And then I went straight back into it, but I got straight into the spiral again. It was kind of a big thing, and then ended up coming with you guys after the phenomenal coaching. It was something that I was so passionate about, and getting the opportunity to work within something that I'm so passionate about and that genuinely has changed my life. It was such a relief, and now I'm happier than ever, kind of doing what I love. So it was a bit of a journey.
Kate, could you tell us a little bit about how you felt? Were you worried about Rachel when she was working door to door?
Yes,
Okay.
constantly. Yes, yeah. Yes, the work itself was unsustainable, but yeah, we as well were living on edge all the time, waiting for that phone call of, illness. Then also the flip side in that the social life, it was out late.
Yeah.
A little bit of erratic behavior, perhaps, right? A little bit of dopamine mining. And we were always just waiting anxiously for the next phone call. And of course, we wouldn't get phone calls. We've mentioned that for maybe days or weeks on end. And then perhaps there'd be a crisis call.
Yeah.
Yeah, we were constantly anxious as well. And yeah, we were so relieved when a few months into your coaching with Stephanie, wasn't it, that you realized that actually the work you had been doing was not sustainable, and it gave you the courage and the hope that you could move from there and move on to something way more suitable for you. And this is where you are today.
So let's get into that. So how did you encounter ADHD coaching, Rachel?
So it's actually quite a fun story. So when I was doing door to door, I was actually down the road, and my coach who I was working with within sales, obviously, was actually at a door, and he went, "Oh, Rachel, come over." And I was like, "Oh, okay." I was probably singing and skipping down a road, and I walked up, and he was like, "Oh, this is Stephanie. She's an ADHD coach." And I went, "Oh my goodness." And it was something that I'd always thought about, because when I first got my diagnosis, my mum was obviously looking at kind of what the next steps are. And she talked about ADHD coaching, and would kind of send some things before the coaching, not knowing how to prioritize myself. I just wouldn't really look into it. I didn't have the time, the energy, or the kind of need to prioritize myself. I would just go, yeah, no, I need to focus on what I'm doing. And so having that moment was just like, oh my God, this is what I've been looking for. And I just remember the more I spoke to Stephanie, the more she noticed, and she was like, I can see all of these things. And she was like, yeah, you know, you're people pleasing and you're doing this. And I was like, oh my God, I was like, this person understands me. And the energy was just so phenomenal. And obviously Stephanie's so lovely. And it brought me so much hope, that I was like, oh my goodness, there is something I can do about this. I've got the diagnosis, and I understand a little bit more about it. But it was like, wait, there are ways that I can actually make life easier. It doesn't always have to be a struggle. And I just remember feeling so overwhelmed with happiness, relief. Like I got to the end of the road and we got round the corner and I just broke down and I was in tears. I was like, this is what I've been waiting for. I was like, I need this. Like it then kind of, obviously it took me a while to actually get into it because again, I couldn't prioritize myself. So I couldn't reach out. I was like, yeah, I'll do it this weekend. I'll do it this weekend. I'll send an email this weekend. We'll get it done. And I left it and left it and left it again until I was in another spiral. I remember it was over an unpacked suitcase that I'd had sat around for weeks. And I was just like, why can I not function like a regular human being? What is going on with me? Why can I not get these things done? And I had a big old cry, a bit of a crier. And I called my mum and I was like, I need this, but I can't reach out. And amazingly, she was like, yep, absolutely fine. And I was like, what do you mean? It's okay for me to ask for help. I can do that. And so my mum reached out. I got started with coaching and it's been uphill. Every time I come out of a session, I'm like, there's another level of understanding. There's not just about myself, but about others. And it comes from that understanding of myself that I can understand others. I can work out why things are affecting me, which took a lot of the frustration away because I would get angry and frustrated and upset because I didn't know. And I was just like, why am I angry about this? Why am I upset about this? Why can I not do this? And having that understanding of myself and other people, it kind of put a lot of things into perspective for me. So it was a massive kind of chance encounter, but one that I wouldn't, kind of take away for the world. I think at that moment it was a massive turning point for me. It was like it was meant to happen, and everyone I've spoken to, obviously, have built a great relationship with Stephanie, and obviously with you, and with all of the team. Everyone is just so lovely and so amazing. It feels like the right environment that I've been waiting for. People understand me. People understand how my brain works. They're not like, oh, why can't you do this? It's like, yeah, no, I get it. That's fine. And I'm like, oh my gosh, okay. And I feel seen, I feel appreciated. So I'm so glad that I found it, and I wish that I found it earlier because it would have saved a lot of horrible self-talk, but I'm so happy that I did. So it's been a pretty incredible journey.
Wow, that's a wonderful, wonderful story, Rachel. I can say for absolute certain you're doing an absolutely amazing job. Kate, what was your reaction when Rachel started the coaching?
Well, wow, really. Very, very quickly, we started to notice the changes. The practical side of her life, so became less chaotic. She started to develop routines with Stephanie's help, talking through what was preventing her from having a routine that was healthy and sustainable, and working out solutions together, solutions that, will be lasting her whole life. So less chaotic, routine, control, another big word I felt, another C word, along with communication, control over her life. For the first time in her life, I began to feel that she was controlling her destiny rather than, her ADHD, as we now knew it was, controlling her. We know that she won't miss out because she didn't get her audition tape in on time, or she overslept on audition day. If she misses out, it's because she's 5'9" tall, and actually they're looking for a 4'8" actress to play young Queen Victoria. And that's why Jenna Coleman got it, not Rachel Jones. So, she can control, and hopefully, that will give her peace, happiness, which is all any parent wants for their child. If the acting doesn't work out and she decides to move to the country and raise chickens, then that's her decision, but she has control over it, and she's not going to move away with that feeling of failure, the self-loathing. and all of that goes with the ADHD, the guilt and so on. And as a parent, it's just joyous to see, because that's all you want, is a happy and healthy child.
It's wonderful to see the effect the coaching has had, because it can have this effect. And it does really have that transformational power it helps people understand how their brain works, I think maybe the best way of putting it. Would you say that, Rachel?
I would, yeah. It's understanding that and understanding why things might get in the way, and naming it to tame it, obviously, and putting a kind of, okay, that's what it is. So then I can recognize it, actually live my life how I want to, and not just kind of people please because that's what I need to do, because that's what my ADHD tells me, and that's what I've kind of always thought that I had to do. So finding the ways that help me maybe say no to things or do what I want to do because it's what I want to do, not because somebody else wants me to do it. What I like about coaching is it's not just kind of do this, do this, do this. You know, you watch the YouTube video and it's like, write a to-do list, you know, wake up at 5 a.m., go to the gym, and then you'll be able to build a rocket. And I'm like, what? And you do it for a day, and I'm like, no, it doesn't work. And then you end up feeling frustrated at yourself because you're like, why haven't I built a rocket? Like, I followed everything perfectly.
Where's my rocket?
Exactly.
You do this, you'll be a millionaire in 5 months. It's like,
exactly.
Why am I not brassic?
And I'm like, okay. And then it's like, well, no, that actually doesn't work for me. It's not just a general kind of, these are 6 ways that are going to sort out your life. You need to find something that actually works for 100%. You. And so it's not just Stephanie giving me, do this, do this, do this. We actually talk about it, and it ends up coming from something that I'm genuinely interested in, coming from who I am and my motivation.
It's the old saying, Tim, isn't it? It's the it's not giving the man a fish, it's teaching the man to fish.
100%.
Completely.
It's 100%. It's that. It's not the therapy approach. It's not looking back. You know, obviously the past is important. It's about working forward, how to work with your brain, with who you are, as opposed to saying, do this, do that. This is let's try and sort this out from the past, because the more you go back, the more you start thinking, oh, how, you know, that's where the focus goes.
Exactly. And that's strengths based. It's such a powerful thing, because when you're kind of talking about everything, ruminating on everything from the past, it's important to look at that. It's important to unpack that. But when you're constantly focusing on that, the more I've been focusing on my strengths and what's worked for me, the self-confidence has risen. I'm actually more likely to say to someone, yeah, no, I know what I need, because I know that's worked for me. I know who I am. I know what my strengths are. Looking at what's worked brings so much more. Oh, wait, yeah, no, I have done it, so I can do it. And focusing on that brings so much more power, rather than, oh my God, yeah, no, your life is hard when you have ADHD. There are things that are really tough, but you've got to, rather than sitting in that, you've got to look at what you can actually do really well because of your ADHD and because of who you are. It brings so much more fire and so much more drive.
As you say, it's that strengths-based approach, because if you focus on the strengths and the things you can do, you'll get better, even better at them, and then move forward. There's almost no way you couldn't. Whereas if you focus on what you can't do, it's like putting round pegs in square holes, and then you'll just go down that, oh, I can't do that, can't do that. You know, don't try and make a horse swim.
If we hadn't established the ADHD already, it was that, oh, can horses swim? And then all of a sudden I was on that topic and I was like, great, that's not what I think.
Cross dance, maybe? I don't know. But don't make the things you can't do. As you say, focus on the strengths.
Definitely. You know, in the past, when we've tried to offer help with things that we can see weren't your best skills, it would be rebutted, refused. There's been quite a lot over the years of, it's called PDA, isn't it? Pathological demand avoidance, lots of no's when you were tiny. But then, of course, as you get older, that has more serious consequences when it comes to things like not paying your bills, not filling out vital forms. And like we've tried to say to you, you know, play to your strengths. You know, there's the same in my relationship with my husband. You know, that's normal, recognizing that one of you is the one that focuses on paperwork, the other one can take a computer apart and put it back together. But don't expect the one that takes the computer apart to pay the bills on time. And it's the same with ADHD, but I think it was the refusal of the help, or the not wanting to ask for the help. But now you are asking for help, aren't you? You're accepting help in the things that aren't your strengths. And quite frankly, what you do, we couldn't do. We're in awe of you. And yeah, like I say to you, I don't think Richard Branson fills in his own tax return. We'll do your tax return. You do what you do the best.
It's lean into interdependence. Like Stephanie always says, don't do independence. No one does independence. No one does everything on their own. It's an idea which people try and follow. But as you say, if you look at Richard Branson, if you look at Michael Phelps, I'm sure Michael Phelps doesn't do his own tax return, but you don't ask an accountant to be a champion swimmer. As you say, it's focus on your strengths, lean into that interdependence if you can. Don't do the things you're terrible at.
That was the difference for me between looking at my strengths and looking at my struggles. When I struggled with something, I was more likely to be like, oh, I don't want to do it. But because I'm so focused on my strengths, the fact that I'm maybe not as good at something, I know what I can do really well at.
Yeah.
So it becomes easier to delegate that because I now have more of an understanding of what I do well. I'm not focused on, oh, I can't do that. And it sits and it ruminates, and then you feel bad kind of asking for it. It's like, I'm really sorry, I really struggle with this. It's like, I'm doing this so well that it's actually okay for me to ask for that. And the interdependence is so important for us ADHDers. Being able to do that without the knowledge of your strengths is quite hard. It's very hard.
But there's so many things, for example, I haven't applied for because I just thought, oh my God, there's a 20-page form, and just thought, sorry. Well, I'll start it, or you start it, and then just think.
Asking for help it was for me extremely hard. It was, the rejection sensitivity of going, what if this person says no? They're now going to change their opinion of me. And if I'm already feeling so bad about that, then having another element of now I have to ask for help with it. It's like, but because I'm so focused on what I'm doing so well, it becomes so much easier. And you realize how that if you ask someone to do something, most of the time people go, okay, yeah, that's fine.
Absolutely.
Before kind of focusing on that, I was so in my head of, oh, they're going to think this, they're going to think that. Now I'm going to feel like I'm asking everyone for everything. Everyone's going to feel like they have to do this, and that I'm now an issue, and I'm now this. But that wasn't the case. It was name it to tame it. It was RSD. It was my signature strengths. It was that was making me feel like that, not what was actually happening. Has brought us closer, me and my mum, because you wanted to help. She's an incredibly kind person. She loves to help. It's why she does what she does. You kind of speak to anyone and they're like, yeah, she does everything for everyone so much, and it's so incredible. And so I'm so grateful that I have that. It made it so much easier because you wanted to help, because you could see that I was struggling. My kind of rejection sensitivity, I was like, no, it's fine, don't do that, which sometimes came across as me pushing you away and me trying to go, no, like back off. But it wasn't that. It was internal fear and all of this. I don't want to seem like I'm bad at something. There are already so many things I'm bad of. I don't need to do that. Being able to ask for that help and being able to let you help, it just made such a big difference for us. So for me, coaching has transformed my life. It's transformed my relationship with my family in so many ways. So it's every aspect of my life. I'm like, wow. I think back and I'm like, oh my God.
And is there a message you'd like to give to anyone who's thinking about doing ADHD coaching, or knows someone who might benefit from it?
I would say to anyone who'd kind of been thinking about coaching, I would say it is probably one of the best decisions that you can make, not just for yourself, because as ADHD it's very hard to do things for ourselves. But if doing that for yourself is hard, for everyone around you, it will transform so much of that. so much of my life has been changed in terms of with my friends, with my family. Starting off is incredibly hard. It's incredibly hard kind of going and taking the leap and doing it because we're not as good as doing things for ourselves. We're very good at doing things for others, but for us, not really. So I would say if, if you're in that place of struggle, if you're in that place of spiral and you feel like there kind of is no real solution, there is. It's changed my life so much. I don't know where I would be without the help that I've got. You've got to take that leap. You won't regret it. The only thing by not taking that leap years down the line, if something happens like I did when I first met Stephanie and then waited ages to start, I only did it because I was in another place not a very good place. If anything, I'm like, I wish I'd done it sooner. I wish I'd found it sooner. So if you're seeing this and you're thinking about it, take the leap because it changes so much in so many ways would be my thing. What would you say, Mother?
Yeah, absolutely. Echo all of that. Plus, if you're feeling that you're not worthy yourself, don't look at that. Look at your family, do it for them because, the changes for us have been so enormous as well. The reduction in our stress, our worry as well for you, have also been enormous. Massive changes, literally life-saving. We're aware of that. Best gift we could have given you. If you're thinking, can I afford it? Talk to your friends and family. They'll help you out. It's an investment in your future. It will pay dividends, undoubtedly, in bucket loads. It's an investment in the person's happiness, their life, their well-being. Absolutely worth it. So I would say coaching has just quite simply given us our daughter back, but back in a whole new way, better than ever before. And we're just now so excited to see where she's going with this because she has control over her destiny and, just the power to be happy with whatever she chooses, wherever she goes. So, it's also a massive thank you from us to Stephanie, to Empower, and also briefly, touching on Ascend for the employee angle and employers as well. The whole package is there. And just get in touch, just do it. You won't regret it.
Oh, thank you so much, Kate. It's been an absolute pleasure to have you both. Thank you so much, Rachel, as well. And it's been wonderful to have you both. Thank you so much.
Wow. That's the first time I was watching that at the same time. So yeah, it's hard to respond to that, but it's been mutually beneficial. Rachel is amazing, and honestly, what she's been able to do for us as well, and is just no words. She's an incredible person. It's again just such a privilege to be able to help, someone as amazing as she is to be able to reach, or be on the way to her potential because she's meant for great things, this one. So watch this space. Yes. So apologies to Lauren. Lauren, I know we were going to start a little bit earlier and I haven't seen you for several years.
And I think it's been like 5.
Oh my God.
4.5, I think.
That is mental. I can't, like for me, like I literally still remember our 2 weeks of joy.
Oh God.
So, no, thanks for coming on. And don't worry, I won't take too much of your time. I know we're nearly at 8 o'clock. And the people on here, it's been since 4 p.m. But thank you for waiting. But yeah, I mean, so do you remember that time? What got you to reach out? I mean, what got you to reach out to us for help?
I was in my 3rd year of uni and it was like it was like the March, April-ish time when everyone is about to go on break and then everyone does their dissertations in that time, like give or take. And I'd got through like A levels in uni by like doing everything. Like I always did like average to well, but I did things really last minute. And up to that point, I think the only essay lengths we'd been doing were like 5,000 to 6,000 words. And then my dissertation was 20,000 words. and you can't do a 20,000 word dissertation the night before. And like the quality of a dissertation is a bit of a different thing to like what we'd been doing. And I think it was like 6 weeks or seven. I can't really remember the ins and outs. But it was like near enough.
I was
And I
gonna
had
say- Oh, you mean when you read? Yeah,
yeah,
yeah.
I can't. And then obviously the difference with a dissertation is everyone's doing different things. So like before in A levels, for example, we'd all have the same question for coursework. So like we could all help each other. Whereas this, like you're completely on your own. Um, and I literally just got to the point where I was like to my mum, like, I cannot get this dissertation done. Like I can't physically do it. Like it wasn't me being dramatic. I was like, I do not have enough. Like it was my fault. I'd left it too late, but the research needed and the like to write a 20,000 word essay. And then the bigger part was actually the footnoting and the referencing, because if you don't do that properly, you can obviously be penalized and like will basically be kicked off. Um, so there was also that part. So I just basically couldn't do it.
I mean, so overwhelming. I have
Yeah,
other university students, and through the dissertation, and it's like being, in the trenches with you guys. Like honestly, it's full on. It is so full
yeah,
on. Yeah.
yeah. It's just a massive, well, for me, it was a massive jump from what I'd been doing before. Like just the objective word count being like 5 times the size was
Yeah.
just huge.
Yeah. I mean, again, because there's so much choice, isn't there? Like, and particularly, how much did you research?
A
You know,
lot. I did a lot of research, which was also half the problem.
like, what did you find? What was the problem with that?
Well, like I do this in my job as well now. Like I will just keep researching and researching and like finding too many options. Because that's I find more interesting, and I find that a lot easier than actually writing an essay, because that's where like actual organization comes in. So I just kept researching. Just too much, yeah.
And so, what helped with the coaching? Because that's the thing, isn't it? Like when you've got that choice, and when there's kind of no one to kind of look at you and go, "Hang on," yeah,
Yeah.
really helpful there with the coaching.
Well, the coaching was so helpful because I feel like, if you're stressed and you like ask a friend or a parent or a teacher for like help about how to do something, they'll tell you to like, I don't know, like do a word count for the day, or like, work an hour and then have like a 5 minute break or something. But like all the help you'd get from like people that don't understand how your brain works because of the ADHD, like it's so unhelpful. And I feel like you keep trying to implement, like I think I kept when I came to you, I was trying to work for like 45 minutes an hour. I like around that time, and I just couldn't. And the problem is when you set those goals and you're not reaching them, you just then end up procrastinating more. So what the coaching was really good at was actually putting in place a structure and just basically the practical tools on how to get the like dissertation done.
Yeah, I know. It's been a while, like we said, several years, and went back to your coaching record.
Yeah.
What was that like seeing, the whiteboards? Remember the whiteboards? Always look at the whiteboard. Yeah, I mean, how was that going back and looking at, those whiteboards? What was
No, not horrible. That was like I think that was like the most horrible time. Just
Sorry. I'm so sorry.
No, you made it better. Just like the doing a dissertation was like the worst thing I've ever done. But like looking at it was just interesting because I think even now I was like, I probably need to do more of this now. Like,
We need
in
to
my,
get back to
I
coaching.
know, in my job and stuff, and like because it was so helpful and like yeah, because I think when you've got so much to do, and I had so much to do, and like, I saw my dissertation tutor, I think like maybe not even 3 times that year. Like there's no one to check in. So just having that structure that I was rereading about, like, do 25 minutes, then a 5 minute, and then like ways to combat if I'm feeling like I'm going to procrastinate and stuff.
Yeah, there were a few times I remember, like, so usually we do kind of weekly coaching, and at the begin, I think because you had, I think it was 2 or 3 weeks. I don't know. We had literally
I think it was
six.
around that.
We were like, and
Yeah.
you know, like it was really tight. And the first, obviously, when we first started, it was about getting clear on the plan.
Yeah,
But it was the question even. So it's like, do you remember in terms of your essay? Because it's all up here. And
yeah. The problem was I had so much research, and I had to organize the research, and then half the problem was like getting the structure of the essay together. And I think I was just too over, like it was just too overwhelming.
do you remember what we did to get around that? It was on one of the whiteboards. I
Was
got,
it the color coding?
what was that?
The color coding.
Before that. So, because what usually happens again with the research we do, we also do it as a kind of a safe. It feels like a safety net. It's like I'm going to research everything. And then I've got look,
Yeah.
it'll be fine. Look at all the stuff.
Yeah, but then it ends up more stressful.
Because you're like, but I can't use all. Hang on, but now I'm
Yeah,
question now. It's like you've just gone completely off the question. So what I got you to do. I remember because like I remembered when I saw the whiteboard, I got you to just verbally, like without looking at all your notes. Do you remember I said, Lauren, right? So that's the question. Go on, like kind of just verbally process. Just talk to me about
yeah,
how are you going to tackle this? What's the answer? How, and then you just talked and I wrote it out.
yeah, yeah. It was like, yeah, I think there was just too much in my head. So it was, and then also because you're just on a screen, and then you've just got, I think I probably had like 10,000 what like words of notes. So it's just too much. So
Exactly.
yeah,
So, and that's what we had to do. We had to kind of get you to step back because you were kind of buried. Like when you're too close to it all, you know, that's when we get kind of overwhelmed paralysis and kind of, but how do I? So it's like, no, step back, don't look. How,
yeah,
you know, because you kind of probably, a lot of us, we don't realize how much we actually do know. Like, because you would have done all the reading and stuff. And we,
yeah. I think I just never had anyone to help me like actually put into practice things that were actually helpful for me. Like all the advice you get was just like it was just, I'd never found anything helpful, and then it just gets more frustrating.
yeah, no, because it was, because again, with the coaching, right, it's different, I guess, to when you have a dissertation tutor. Is it like, and you know,
Yeah,
complete,
they're not. Yeah, you just. I mean, I can't speak for everyone. I had one dissertation tutor, so like that's literally just my one experience. But they're not really there to help you, like, or like. But then I don't know. Someone else could have a really different dissertation tutor, and this was a while ago. But she's there to help you with like your thoughts and like the actual like academic research and how you organize the research, but not organize it in a practical way of like how long you should be spending on X, Y, and Z, more organize it in the sense for the essay about like, oh, okay, like your introduction should bring in this part of the research, but she's not there to like, or he, sorry, they're not there to like actually help you organize your time, if that makes sense. And
yeah,
that was the problem.
yeah, getting clear, holding space, you know, quite often that's what it was, kind of holding space, particularly at the beginning, for you to kind of get clear about what you had to do. But then
Yeah.
also we did an actual plan where we were like, okay, we've got 2 weeks. And then so it's like we set out every day,
My
you know,
God.
on the whiteboard so you could see it. Yeah.
Yeah.
What did that make, being able to kind of see those days?
Yeah. No, it was good. I think I actually don't think I would have done it otherwise. Genuinely. No, it was, I think just when you've got so much like in your head and there's so much to do, like you said, like you actually just get paralysis. Like the more there is to do, I feel like the more stuck I'll get. So like having it kind of out of my head and then like on something and like really broken down was like the only way I think I could have done it, to be honest.
Yeah, and then because we usually do that kind of 1 hour coaching, but for the dissertations, things like that, where we then split, remember, it was like 10 minutes kind of thing.
Yeah, but that was so much more useful because then that like the problem was is I had months to do it, but I had no one checking
Yeah.
of what I was doing. So it was, yeah, it was so useful having a check-in every day, and then we could like adjust day to day a bit about what was working, what wasn't.
Yeah, because we had a plan, we had a roadmap out, didn't we? So you were kind of clear on what you wanted to do by the end of that day. You would check in how to go. And I remember there was this like TV series. I think you got
Oh,
owned.
yeah. I was obsessed with Married at First Sight Australia.
That's right.
And I remember saying, I said to you, all I want to do is watch Married at First Sight Australia. Yeah, and then we had to use that as like motivation to like, yeah, no, I do that still if I really want to like watch or read something, like that's all I want to do all day. So it was good motivation.
Was one of the barriers, and that's why the kind of regular check-ins are helpful, because they catch, rather than letting you watch. If I hadn't seen you for like a week.
No, 100%. And what would have happened if I hadn't seen you every day is I would have left it till the day or two before we were meeting to get it done. And then to be honest, like you're like it's not like I was sending you my work and like my essays to check in that sense. So like yeah, it just made a lot more sense to do it every day in smaller bits.
No, it was fun. It's kind of, full on, right? But it's so memorable, I have to say, that in terms of coaching, all my coaching, it's with you guys, the university students, and the dissertations. Like, you don't forget that.
Yeah. No, I genuinely think I would have had to like repeat the year or something if we hadn't have found you, or like I would have had to do it in summer or something. I just wouldn't have like, or it would have just been awful. I would have got like a really bad grade.
Or like what you just said there, if you had have tried to do it in one night, you wouldn't be very well, or like, you
No.
would.
Yeah, but the thing is if you handed in that essay not properly referenced and like footnote, what I can't even remember the word. I haven't written an essay in years, but like
No, sorry to do this to you. I'm literally.
what was it footnoted? I could have been like I could have been just like kicked off the course if there was plagiarism and I hadn't like if I'd left like if I hadn't have done all the referencing properly after and like not quoted things like they can kick you off for plagiarism. So that's why it was so like it had to be done properly.
Yeah, no, it's a nightmare. So well done. And how did you go at the end?
Yeah, I got a 2-1 on it, which I think I was like 1 mark off a first on it, which was really sad.
You know.
But no, I was, to be honest, like I don't spend my life wishing I'd got a first on it. Like I was happy with the 2-1. And to be honest, like I don't think I was gonna get a first on that in the time I did it. But
Pretty amazing, actually, considering.
yeah, no, but I'm really happy with what I got on it. And I was happy with the essay in the end, actually. Like I was happy what I gave in.
Yeah.
So
No,
yeah.
no, honestly, it was a pleasure. And you got your ADHD diagnosis during our.
Yeah, I wasn't diagnosed. Like,
Mm.
looking back, like it was so obvious. And it got to the point where, like, I obviously did have AD. Like, I'd been to like a hypnotherapist to help me concentrate years before because I couldn't do my GCSEs. So, like, I think we kind of knew, like, if I saw a psychiatrist, and obviously, like, I don't know if you said, like, I obviously did have ADHD, so we got you in to help coach me through it because either way I needed help, whether it was ADHD or something else, I needed a coach to get me through it. So I got diagnosed, I think within those, I think just a few months later or something. I can't remember, to be honest.
I think it was kind of, yeah, during it, but and what did that do though, once you kind of knew officially? Because obviously you'd been doing the coaching as well, and we'd been talking about the
Yeah.
in that context. But once you got the diagnosis, how did that change?
I mean, I think my main thing was getting the meds.
Mm.
Obviously, unless you've got a formal diagnosis, you can't get medication. The med, like, I actually can't imagine doing life without meds now.
And you did this, and this is the thing, you did the dissertation without meds.
Yeah, I honestly look, I don't know how I did that. I mean, but I'd done life though. I'd done 21 years of life without the med. So it would have felt, it would have been like, it would have been harder now doing it off meds, if that makes sense, because that's all I was used to.
Plus also the thing is the pill that, like they say, the pills don't give skills, and the danger, right, could be you'd be motivated, and guess what? What would you be focusing on?
Well, no, I don't, I think if I'd been on the meds and didn't have your coaching, I don't think I would have done it. But yeah, no, the meds are really good, but no, like having practical tools, like you like, really need them, maybe even actually more than the
Yeah.
meds, to be
Yeah,
honest.
someone to keep you out of your own way. They talk about, the Ferrari brain bicycle brakes, and with the meds, it just kind of supercharges the Ferrari brain as well. And you could have maybe would have done a lot more, even more research, and got
Yeah, that's actually. No, I don't think. Yeah, I think at that point, I think the meds would have been like helpful, but I don't think. I think the coaching is what I needed to get it done because I was used to do it. I was used to doing my life without meds and that. So like, I wouldn't have known any different if that makes sense.
Yeah. And so what are you doing now? So now that like, yeah, I know it was a distant memory until I dragged you back into it tonight. But yeah, so what are you doing now?
As in work wise, well, I am freelance. I'm technically a bit unemployed at the moment. I just finished on a really long, I work in film and TV. I'm a buyer um for the set. Well, I was in props, doing action props,
Yeah.
but I'm normally in the set deck department, so we like make the sets. So I just finished, I'd been working for like since Jan till
Oh, wow.
like 2, 3 weeks ago. So I'd been on a really long job that was really far. So I'm having a bit of a break now and I'm moving out. So I do need to start looking for another job, but I can't really be bothered.
Have a bit of give yourself permission. Because these things are pretty full on, aren't they?
Yeah.
Non-stop. Like you're out.
Yeah, I mean I started at like 7:30 in the morning and I'd have to get up at 10 to 6 every day for 8 months.
Okay, so
Yeah.
give yourself permission to take some, it's all
Yeah.
then December's Christmas.
Yeah, that's what I'm thinking. So I'm just getting like organized to move out and then I'll slowly start doing
Yeah.
messages for jobs, but I'm not in a massive rush at
Fill
the
up your
moment
tank
because I'm quite
as well. But
but
fill up your tank, when you can, because
yeah.
again, right? The way
Yeah, no, I know. I think I got offered like a day's work on like a Waitrose advert or something, but I just couldn't be bothered. I was just so like the idea of it was so overwhelming. I was like, I actually need a break
have a
after the job.
do something, do something fun, spend time with family or your friends. I know you used to love seeing your friends. I remember talking about you going out. I think you gave that as a reward for some of your dissertation thing. I remember that. Yeah, you go out, if you had to get this thing done, then you could go out. Yeah, go see some friends. Go live life. But honestly, thank you, like Lauren, thanks again for coming on. And it's so good to see you after so many years.
Oh, thank you for having me.
Yeah, well, we'll always have that memory. I know we'll try and forget it. Try and forget
Ingrained in my mind.
it. But thank you and have a great night and let's catch up again soon, I'm in touch with your mom anyway, so yeah, I'm sure I'll be speaking to you again soon.
All right, thanks, Stephanie.
Good night. Thank you. And I am just very, very grateful that these amazing partners of ours, our clients, were able to take up some time, particularly this Halloween, to spend with us and to raise awareness about the importance of ADHD coaching and training. And we are just really excited, already thinking about the next one, but also very excited that we are now wrapped up October ADHD Awareness Month. Having gone live every day, I have to say, as always, it has definitely been a challenge, but so worth it. And our team at Empower ADHD, the coaches, again, the time they've put in, the amazing LinkedIn lives they've done as well, which you can see on our Empower and Ascend ADHD YouTube channels. Again, so grateful for a fabulous team, and we've got some other people that will be joining our team very soon and very excited about having them on board. So get in touch with us, either subscribe to us on LinkedIn, Ascend ADHD, Empower ADHD, or email us at info@empower-adhd.com. So that's it from me, over and out this 2025 ADHD Awareness Month. Happy Halloween, everyone.